and Victoria Landland. There's just a whole team behind this, and I want to make sure we thank all of them for the incredible amount of work that we're doing and that we will get to do with them. And as we move forward, I just want us to think about a few things as you listen to the rest of the conversations today. Where are areas that we would want more information? Where are areas that we would like to have others come back and present to us? So as all of us as commissioners are listening, let's make sure we also keep thinking about who else we need to hear from, who else we want to talk to, where else could we use more information to inform decisions, to understand what's happened, to understand what more we can do. So keep that in mind, because as we set up these working groups and our subcommittees, this is going to be the opportunity we get to ask of and also talk to others in the government, as well as other experts that we may want to bring in to have conversations with us to talk about how we develop recommendations. So as you listen to the rest of these presentations today and the conversations today, please do keep that in mind. I know I'm certainly taking notes, but this is our opportunity to think about, what else do we need and what else are we looking for in informing our decisions and our charge moving forward. So with that, I am super excited to reintroduce Crystal. We've heard from her already, Crystal Kai. She is, as you know, Executive Director of the White House Initiative and President's Advisory Commission on Asian Americans, Native Hawaiians, and Pacific Islanders. She is also the first Native Hawaiian to hold this important role, and in her capacity advises the Biden administration on federal programs and policies related to AA and NHPI. So I am so lucky that I have been able to work with Crystal over these years, but I just want to say we are extraordinarily lucky to have her as our executive director and super excited that she is here. So I'm going to turn it over to her as she sort of introduces the Federal Interagency Working Group, how it works, why it's important for us, and how she interacts with them too.
Thank you so much, Sonal, and hello again to all of our commissioners joining us from all around the country and to our audience tuning in live. Again, my name is Crystal Kai, and I am the Executive Director of both the President's Advisory Commission as well as the White House Initiative on Asian Americans, Native Hawaiians, and Pacific Islanders, or what we call WIONP. Both of these entities were created last May through President Biden's signing of Executive Order 14031. And although they are separate entities, the work of both the Commission and the initiative complement each other very closely. The White House Initiative on Asian Americans, Native Hawaiians, and Pacific Islanders includes two major components, including a federal interagency working group, as well as a regional network comprised of federal officials based in the 10 regions across the country, who really help us to ensure that we are delivering on the President's promise to advance equity, justice, and opportunity for the Asian American, Native Hawaiian, and Pacific Islander community. And you'll be hearing a little bit more about the IWG in my presentation, and you will be hearing more about our regional network shortly. I wanted to bring up these two components because historically, the Commission and our White House Initiative components have worked very closely together. And as Secretary Becerra mentioned earlier in his remarks, both of these entities, both the Commission and the Initiative, have actually existed for over 2 decades. They were first created under the Clinton administration in 1999. And so we have a long history of making sure that the federal government is really coordinating closely across the entirety of the government to ensure that resources are accessible and available to our Asian American, Native Hawaiian, and Pacific Islander communities. And the real joy of having the Commission is also knowing that we have trusted partners outside of the federal government who can help to advise and inform the President and inform the work that we are doing as federal officials to make sure that government is truly working for the people. So I have the next several minutes of having the pleasure to provide a brief overview of the White House Initiative's Federal Interagency Working Group, or what we call the IWG for short. And I will discuss how the IWG and Commission will work in tandem to advance equity, justice, and opportunity under the work of this administration. Next slide, please. So for today's agenda, I will provide a brief background of the White House Initiative's Federal Interagency Working Group and share its purpose and membership. And then I will go into an overview of the IWG policy goals and priority areas. I will conclude by briefly going over the main deliverables for the IWG and describe how this group and the Commission will work together to achieve shared goals. And as you can see pictured here, there is a picture actually of IWG meeting with the President's Advisory Commission back in 2013 at the White House under the Obama administration. So we absolutely want to make sure that there is close work both between the Commission and the Interagency Working Group members as we move forward on the work that we have ahead. Next slide, please. So in terms of background, as I mentioned earlier, the Interagency Working Group was created through Executive Order 14031 as part of the White House Initiative. And this executive order not only reestablished the White House Initiative on Asian Americans, Native Hawaiians, and Pacific Islanders, or WIANPI, but it also created the President's Advisory Commission, which you all currently, are just newly sworn in, and so we are so grateful again for the work of this initiative, as well as the Commission and the executive order that President Biden signed last May, which really not just reestablished these entities, but reinvigorated them and expanded them in ways we have never seen before. So in addition to changing the name, previously, I think many of you have worked with previous iterations of this initiative. It was formerly called the White House Initiative on Asian Americans and Pacific Islanders. And as Erica mentioned, in her remarks, this is the first time in history that Native Hawaiians have explicitly been named and included in a presidential initiative and commission in this way. And so we are truly grateful to the Biden administration for making that name change and making it very clear again to explicitly name communities that have often been overlooked and underserved by our federal government. So our new name is the White House Initiative on Asian Americans, Native Hawaiians, and Pacific Islanders, and it includes our Interagency Working Group that is co-chaired by U.S. Secretary of Health and Human Services, Secretary Javier Becerra, as well as U.S. Trade Representative Ambassador Catherine Tai. And both of our co-chairs also serve as co-chairs of the Commission. They are tremendous leaders, and we are so grateful to have them with us, and just their tremendous leadership leading this charge as we work to build a brighter future for our communities, knowing that we have faced significant challenges, especially over the past 2 years with the COVID pandemic. As I mentioned earlier, in addition to my role as both the executive director of the Commission and the initiative, we also work very closely. The executive order explicitly names the position of the Deputy Assistant to the President and AA and NHPI Senior Liaison held by Erica Moritsugu. And so we work very closely with her to just make sure that we are coordinating our whole of government approach to advance equity, justice, and opportunity for our communities. Next slide, please. And so the purpose of our Federal Interagency Working Group is to advance, as I mentioned, equity, justice, and opportunity. And the way we are doing this is by coordinating our federal interagency policy making, program development, and outreach efforts to address barriers impacting Asian American and Native Hawaiian and Pacific Islander communities. The IWG is charged with addressing issues specifically outlined in Executive Order 14031, and there are 14 specific mandates that are outlined in that executive order that include a number of different priorities that you will be hearing about later today, but I want to go over just a handful of them. Next slide, please. So first, though, I wanted to kind of give you a little bit more background on the membership of our Interagency Working Group. So the executive order that President Biden signed last May outlined 34 specific federal agencies that are listed as part of this Interagency Working Group. And it includes White House offices, cabinet agencies, and federal independent regulatory agencies. And I gave a few examples there so that you could see in the PowerPoint just the breadth of the types of agencies. So we have everything from the White House Office of Public Engagement and our incredible colleague Howard O that we work very closely with, the White House Domestic Policy Council, who you heard from earlier through Ambassador Susan Rice, and we also have other presenters from the White House Domestic Policy Council who will be joining us later today. We have cabinet agencies, so those like the U.S. Department of Health and Human Services, the U.S. The Office of the U.S. Trade Representative, and also others, the U.S. Department of Education. All of these entities are going to be working collectively together to make sure that we are able to deliver on the charge outlined in this executive order. And then we have federal independent regulatory agencies, so those like the Consumer Financial Protection Bureau, also who are outlined in a part of this executive order that will be helping to assist our work. And, in terms of who the actual membership of this IWG is, it is comprised of senior level executive branch officials who have been designated by their respective agencies to coordinate the initiative's work across the entirety of the federal government, including both in terms of their headquarters in Washington, D.C., as well as regionally across the 10 federal regions. Next slide, please. And so in terms of our policy goals and priorities, there are, as I mentioned earlier, specific goals that are outlined in Executive Order 14031 that this interagency working group and the commission are tasked with pursuing. And in particular, there are 14 goals outlined for the federal interagency working group. And through the different, although they are a little different from the Commission's 7 policy goals that Sonal and Ambassador Tai outlined earlier, the goals of both the Commission and the initiative do have a lot of overlap, and we anticipate there to be a lot of synergy in the work that we are doing together. And from these policy goals that are outlined, and the 14 policy goals that are outlined in the executive order, the interagency working group is currently focusing on specific priority areas that are of most immediate concern to our communities. And this includes the need to address anti-Asian hate and violence, as well as looking at our response and recovery to the COVID-19 pandemic, and then also looking at longer-term systemic issues that we know are really cross-cutting and intersectional across various issue areas, things like the need for better data disaggregation so we can truly understand the diverse needs of our communities, also the need for language access, and building better capacity for our communities, knowing that, again, our Asian Americans, Native Hawaiians, Pacific Islanders are the fastest growing population in the nation, but are also still a relatively young community and need additional resources and support when it comes to accessing federal resources. And another key priority that we are going to be focusing on is just improving workforce diversity, both within the federal government as well as overall, so that we can ensure that Asian Americans, Native Hawaiians, and Pacific Islanders truly have an opportunity to be represented in all sectors of American life, and that we are giving them their support that they need. So in addition to the priorities that are shown here, I know that the IWG is also working on other key areas mentioned in the executive order that are not explicitly outlined here in my PowerPoint presentation, but that are still very critical to our community. And that includes things such as environmental justice and climate change, healthcare access and mental health, education, housing, civic engagement, and so much more. So I just want you to know that the scope of our work is vast, and we are going to be working on a number of different priorities with a particular focus on the issues that I have outlined in this particular slide here. Next slide, please. So I would like to go a little bit deeper into some of our specific policy goals and priorities for our federal interagency working group. And like the commission, this IWG will actually include subgroups that will be focusing on specific areas. So in particular, we have identified a few key priorities that we would really like to focus on, just based on input we have received from community stakeholders about the most pressing needs impacting our community. And at the top of mind for so many in the Asian American, Native Hawaiian, and Pacific Islander community has been this rise in the need to address the rise in anti-Asian as well as anti-AA and NHPI hate and violence more broadly. And that's something that this administration and this president have made a key priority to address. 3 of the IWG policy goals that are outlined in the executive order specifically focus on addressing anti-AA and NHPI hate and violence. And this includes efforts to improve safety, access to justice and violence prevention for AA and NHPI communities, promoting inclusion and belonging for our communities, and also addressing barriers to learning, including bullying, harassment, and other forms of discrimination at school. Next slide, please. Another key priority for us, as I mentioned earlier, is to address systemic issues that have long plagued our community. And many of these issues, unfortunately, were identified over 2 decades ago as priorities for prior iterations of this initiative and the commission. And although we have made some progress, we know that there is still so much work to do in these areas. And in particular, 2 of these areas that I mentioned earlier that we would like to tackle and we plan to tackle through this federal interagency working group are the need for greater data disaggregation for the Asian American, Native Hawaiian, and Pacific Islander community, as well as the need to create greater language access to federal programs, services, and initiatives. Although there has been progress on both of these issues over, like I said, the past 2 decades, you will hear a bit more. We have really excellent speakers lined up for you later in the program tomorrow who will be talking about some of these systemic barriers that have long existed. And again, although we have made progress in the past 2 decades, we know that we have not moved the needle quite far enough because we continue to hear consistently challenges in terms of our limited English proficient Asian American, Native Hawaiian, and Pacific Islander communities trying to access resources that may not currently be available or translated into languages that are accessible to them. And then also the need to really ensure that we are captured in federal data where oftentimes, we are not always visible. And, I think many of us know on this, and you'll hear it later in our presentations from other speakers, but the need for more granular data that is specific to our ethnic groups that encompass the broad, and diverse Asian American, Native Hawaiian, and Pacific Islander community is so critical because without that disaggregated data, it is really hard to understand, the disparities that exist between different subpopulations and also to micro-target resources and intervention. So that is going to be a big focus of our interagency working group, and we anticipate having subgroups both for language access and data disaggregation. Next slide, please. Another big goal of ours is going to be capacity building. And in previous administrations, the initiative and Federal Interagency Working Group have focused on capacity building in the context of federal resources and federal workforce diversity. And so to address the current public health pandemic, we know that COVID-19 has been included as a key priority area that we would like to address, and also making sure that the IWG policy goals reflect the priorities that are included is also really critical. And so we really, for this capacity building piece, we know that so many Asian American, Native Hawaiian, and Pacific Islander communities, as I mentioned earlier, we're still an emerging population, and so we don't always have the capacity or the infrastructure. So many of our nonprofit organizations are volunteer run or have very small and limited budgets and may not know how to navigate and access federal resources and programs. So a big part of the work that we are doing, and especially in the context of our COVID-19 pandemic response and recovery efforts, both with regard to health and economic efforts, as well as education, we want to be able to focus on building greater capacity for our communities, making sure that they are aware of the federal resources available to them, and really prioritize that work. And then with regard to increasing, federal workforce diversity, as well as diversity and inclusion more broadly within the workforce, that is also going to be another very key goal for us, because it is so critical that we have leaders and representatives from our community in all areas of American life in leadership roles who can really ensure that the needs and concerns of our communities are being prioritized. And so I know that the Biden-Harris administration has made a very strong commitment to making sure that we have that representation in the federal government, to prioritizing not just diversity in the workforce, but also equity. And so that is something that we want to continue to do as we are looking to recruit and provide these leadership development opportunities for pathways within the federal government, as well as other forms of also, like I said, more broadly within the private sector as well, just to ensure that we truly have the representation and participation in the workforce that we need to ensure that policies and priorities from our community are not overlooked and are truly addressed at the highest levels. So I encourage you to review all of the 14 policy goals that are outlined in the executive order. Separately, we will send a link and make sure that is available. I know I did not have a chance to go through all of them, but there are so many different priorities that this federal interagency working group will be focusing on that are key priorities for this administration. And I was, so glad that we were able to go through a handful of them that we will be focusing on through our federal interagency working group in the short term. Next slide, please. In terms of deliverables for this interagency working group, so each member of the federal interagency working group is required to produce 2 specific deliverables. And one is an agency plan for how their respective department, office, or agency will help to advance equity, justice, and opportunity for our communities. And so, the U.S. Department of Health and Human Services, for instance, will create, a department-specific agency plan, and so will others that are outlined in this executive order. And then they will present that over to to us as part of our federal interagency working group efforts. And then we are also asking that each member of the IWG provide progress reports so that we can make sure that we have a sense of not just what their goals are in terms of how to advance equity, justice, and opportunity for our communities, but also so that we can actually track the progress that they are doing in terms of implementing these goals and strategies. And all of these will eventually roll up into a report, an annual report that goes to the president each May to discuss how we are coordinating our whole of government response to address, and all of the 14 charges that are outlined in the executive order. And so, I want to just show as well that there is going to be a lot of synergy in the work that we are doing through this federal interagency working group, as well as the commission. As you all work on recommendations to the president, it will be this IWG that is going to largely be tasked with providing technical assistance to you all to see, whether there are existing efforts already happening within the federal government that you may be able to build upon, or if there are specific gaps or challenges, that, need more attention. And I think a lot of the work of this IWG as well will be to help assist with implementing the recommendations that this commission ultimately comes up with as you are working to advise the president on this whole of government response to addressing a number of the key priorities we outlined above. Next slide, please. So this is just going back to a little bit more detail about the IWG and commission, and how, although there are separate, specific roles for these entities, how that, we know that they are going to be working very closely in tandem with each other to inform each other's work. And so this graphic shows that the IWG has 14 policy goals and is comprised of federal agencies and senior officials within the government, and that agency plans, that they will be focusing on creating their agency plans and annual report to the president as key deliverables. We know that the commission, conversely, is, has 7 policy goals, and it's comprised of predominantly non-federal officials and leaders who will provide recommendations to the president and focus on improving the public, private, and nonprofit sector's engagement with the federal government. So again, although there are slightly different charges for both entities, they do work very closely together. And we know that, again, this symbiotic relationship is going to be very key to making sure that your recommendations to the president are, are taken up by our federal interagency working group and implemented, so that we can truly work together to move the needle on so many of these longstanding issues that have been barriers to our community. Next slide, please. So with that, I would like to conclude my overview of the Federal Interagency Working Group. I encourage you to learn more about our IWG by visiting both the website that is listed there for the White House Initiative, which you can access at www.hhs.gov/WHI-AA-NHPI. And if you have any additional questions or comments relevant to the Federal Interagency Working Group, you can please contact me. I know our commissioners have my contact information. And for those in the general public who are interested in learning more about our Federal Interagency Working Group, you can email our email address at WHIAANHPI@hhs.gov. So thank you again. And with that, I will now make myself available for any questions that we may have.
Thanks, Crystal. For anyone that has questions, would you mind just using your raise the hand feature so we can make sure you're called on for any questions you might have, Crystal? Dr. Underwood?
Yes, thank you. Thank you very much for that presentation. It seems a little overwhelming because, you have objectives and then you have goals and you have things like that. So the question I have is on these on the interagency working group. Is there a listing of who these individuals are, or is there a listing of which agencies were selected for that? And is that a closed list? Is it possible to recommend others or other agencies or groups that may have been sort of missed in the original conceptualization of this?
That is a great question, Dr. Underwood. So we do have a list, as I mentioned earlier, of 34 specific agencies that are outlined in the executive order that will be a part of this federal interagency working group. So we can make sure, and that list is available on our website, but we will make sure too that you have access to that. And then in addition to the 34 explicitly named in the executive order, there is also the president has the authority to add additional members to the federal interagency working group. And so we have already actually expanded that out to now we have over 40 different agencies that have received invitations to join our federal interagency working group. And just to clarify, the interagency working group is specific to government employees, so federal government employees. It does not include external stakeholders, but there are ways for the external, for whether it's nonprofit leaders or members of the general public to engage and interface with our group and to make sure that they are informing, again, the work that is being done. And so we have a number of different ways to engage with our federal interagency working group through the initiative. And I know we've already received some inquiries coming from the public. So when that happens, we will usually farm out requests to specific federal agencies that are in our interagency working group. So for instance, if we get a question for, the U.S. Department of State on what's happening in Tonga, for instance, given the recent, eruption and tsunami, then we can use our federal interagency working group apparatus to then reach out to our colleagues at the U.S. Department of State and ask for updates. And we've been able to do that for a number of different issues, just to make sure that our community leaders and also for all of you as commissioners can connect with the right people within the federal government to truly address a number of pressing concerns and policy issues.
Okay, thank you for that. And just, because like Carrie had mentioned the situation in Hawaii, obviously there's similar situations. There's similar situation here in Guam. So, I'm very interested in seeing whether EPA is involved in this and the Department of Defense. So thank you very much.
That's great. Yes, Dr. Underwood, both EPA and the Department of Education are members of the federal IWG.
Thank you.
Louisa?
Yeah, so I know that there's progress reports that get submitted. Do we have access to those progress reports? That's my one question. And then number two, we will be assigned to subcommittees. And is there an opportunity for the subcommittees to meet with the IWG, depending on whatever the committee is doing, just so that there's a closer connection and we get more direct access and are able to, provide quick feedback?
Yes, absolutely, Louisa. So we will be able to ensure that our subcommittees and also IWG members writ large are available to the commission if you would like them to come and brief you. We do have a number of actually members of our federal interagency working group who will be presenting later over the course of this 2-day meeting. So you will hear from some of them. But yes, absolutely. If you are really want to know what the Department of Education is doing on a specific issue or the Environmental Protection Agency, we can bring in those officials to brief the commission, either in one of these full commission meetings that you are doing open to the public or during one of your subcommittee meetings. So absolutely, that is something that will be available to all of you.
Carrie?
Thank you. Crystal, again, impressively large agenda that you just described. I like to be intentional in the efforts. Given the finite amount of time that we have on the commission, I like to set goals that are aggressive but achievable. And so the question that I have is, with everything that you've described, do you realistically believe that it's all achievable?
That's a great question, Carrie. I think we are going to do our best over the course of this, commission and this initiative that are authorized for the duration of this administration to make as much progress as we can. And I think, again, as I mentioned earlier, this work is not just happening at this point in time, although I do believe we are at this really historic inflection point to make a difference. But this work has existed for over 2 decades. And so I think for us, what I would really like us to do, both through this commission and through the initiative, is ensure that some of these issues that were first raised as challenges under the Clinton administration, that we can actually make some meaningful progress. We know that the way, just within the federal government, things take time to enact. But, again, within this kind of window that we have, I do think there is an opportunity, especially given that this administration's focus on equity and making sure that communities that have not always had a voice in government are truly included. I think we have a very, a window to make a lot of difference for our community that will be long lasting. I mean, there are so many things done under the Clinton administration that we are still using till this day. And so I think, again, even though we have this short window, I want all of us to be very, mindful of the fact that even within the next 2 to 3 years, there is an opportunity to make tremendous and lasting impacts for our community that will resonate for decades to come. And then I also wanted to kind of go back to one of Lisa's questions. She asked, will the reports be available to the commission, the work of the Federal Interagency Working Group? And the answer to that is also yes.
And and I have no qualms about the talent that you possess, and I can't speak for the whole commission, but as one individual commissioner, I would volunteer my efforts to help you in achieving your goals. Thank you.
Sorry, Victoria.
Yes, I hope you can hear me okay. Thank you, Crystal, for the information. And I know just with some experience with the Federal Interagency Work Group here in Region 4 in the Southeast, what are some of the other initiatives focused on some of the other target groups like the Latinx and the African diaspora communities, and how are we linking up? Does that happen to the Federal Interagency Work Group, or where does that happen? And, and how do we gain access to some of those reports to figure out where there's alignment and synergy to reach out, as we kind of, form or start joining some of these committees?
Absolutely. That's a great question, Victoria. And yes, absolutely. So we do have sister initiatives. There's a White House initiative that focuses on the Black community, the Latinx community, as well as Native Americans. And so we work very closely with them and have already been in touch with, their respective leadership to make sure that we can coordinate on areas of mutual interest and priority. And I think that's really important, again, knowing that, it's not just the Asian American, Native Hawaiian Pacific Islander community, but so many communities of color that have faced just so many, really, we've seen so many longstanding inequities exacerbated throughout the course of the pandemic. And so I think there was a lot of opportunity for us to come together to have that strong coalition and identify areas of mutual, interest where we can collectively work together. So there is already very strong desire to do that with our sister White House initiatives. And we would welcome, any feedback or thoughts that you all have too on ways that we can better coordinate efforts to ensure we are really making an impact on more broadly, not just for our community, but for communities of color and other underserved and underrepresented communities more broadly.
So we've got 2 people ready to ask questions. Ajay can't use his raise hand feature. So Ijen and Ajay, would you mind asking your 2 questions? Ijen, why don't you start and then Ajay give, and then Crystal can answer those because we're running out of time. Is that okay?
Sure.
Awesome.
Absolutely.
Ijen, why don't you ask the question and then Ajay next?
Okay, great. Thanks, Sonal. Crystal, I'd love to hear from you in terms of the relationship between the Interagency Working Group and this commission. From your perspective, like if we were to knock it out of the park, like just be an incredible, more than the sum of our parts partnership, what does that look like from your perspective?
So hang on, let me just ask, Ajay ask his question so you can hold both of them together. Ajay, what's your question?
My question is very similar. Let's say we are working on a language subcommittee and we want to gather more information from across different agencies, Justice Department, Immigration, etc. So how do we leverage working through IWG to meet the right people and get the required information and go back and forth on it?
Absolutely. So I'll start with Ijen's question. So, if we were to really leverage and harness our collective, energies, both with the initiative as well as with the commission, what does that look like? And I think for me, it means, having us not have to revisit these same conversations 2 decades from now, not having a future commission or initiative have to keep looking at how do we improve language access or data disaggregation for our communities? How can we actually create meaningful change, as I mentioned, in this kind of very narrow window that we have to actually affect long-term, change for our community? And I know in particular with the rise in anti-Asian hate, we have seen these are not new things, and I think all of us know that, but we have now been spotlighted in a national national way that our community has never really received this sort of attention and visibility. And so I think even more so, there is just so much desire to see, really impactful and meaningful change. And so I know I keep referencing the Clinton administration and some of the things done then, but, the Clinton administration President Clinton created an executive order on language access that we still use till this day. And that was, done, 2 decades ago. So I think, again, if we think of creative ways to really think about in a big way, what can we do for our community, whether it's tackling those areas of, anti-Asian hate, language access, or data disaggregation, and creating those recommendations that will, not just live for the course of the next, year or two, but really have that longstanding impact within the federal government and also more broadly, within our society. I think that is really what I'm aiming to do, and hope that we can do together through the work of this commission and through the initiative and, the leadership of all of you represented today. And then, Ajay, you asked about, again, how do we just really leverage and ensure that there is kind of, very close synergy between the work of the commission and the interagency working group. You mentioned language access. So absolutely, like I said before, we want to make sure that you are working closely with this interagency working group. If you need to be briefed, if you have questions about what is the federal government doing on a specific issue that you want more information about, just so you have a better sense of what existing work streams there are or where there might be specific gaps, we can connect you with specific members of our interagency working group. We can have them come in and brief you during one of these, public meetings or during one of the subcommittee meetings. So there are a lot of ways to make sure that, we can ensure that there is that interaction moving forward. And also, like I mentioned during my presentation, when it comes to your recommendations, it'll largely be members of this federal interagency working group that will ultimately be tasked with implementing, a number of the recommendations that you provide. So we definitely want to make sure that there is, communication and really robust interaction between the two components.
Thank you, Crystal, and thanks everyone for the great questions. I think we'll have many more after we go through the presentations today, as you'll hear from many of the interagency working group agencies that will be on this. So again, let's keep this in mind because it's super important. As you have more questions and what we want to hear through the subcommittees, through the commission, we can ask people to come brief us and give us more information, so we can also take that into account in our recommendations. We're going to now move to sort of the next presentations, which are focused on the federal arm, the regional, the White House Asian American, Native Hawaiian, Pacific Islander regional network, which is a very important part of the network that we should be working, that will help us. And the regional network is the key component to the initiative that focuses on links to the AA and NHPI communities within the 10 federal agencies. Our next presenters are Paul Chang, who is the White House Initiative, Asian American, Native Hawaiian, Pacific Islander Regional Network co-chair, working at the U.S. Department of Labor. Mr. Chang serves as the Regional Anti-Human Trafficking Coordinator and is credited with helping to eliminate sweatshops from the garment industry. Great to have you here, and thank you for joining us, Paul. And our next person, and the other one is our next Regional Network co-chair is Ben Raju. He is the regional network co-chair working at the Small Business Administration Association, and he serves as the district director of the SBA's Los Angeles district office, where he's responsible for the delivery of programs and services. Paul and Ben, thank you so much for joining us, and really appreciate everything you do.
Thank you so much, Nal. And hello, everyone. Welcome, commissioners. Good afternoon and good morning to all our friends in the Pacific. And to all our friends listening in, Happy Lunar New Year. And to those who are celebrating, wishing everyone good health. 新年快乐，身体健康，恭喜发财. Both Ben and I are humbled and honored to be here today, representing over 400 officials from field offices throughout the 10 federal regions. We are here in our capacity as national co-chairs for the White House Initiative on Asian Americans, Native Hawaiians, and Pacific Islanders Regional Network. The RN, as we are often referred to, is written in our executive order and is charged with coordinating and supporting extensive network of federal officials, their Their work facilitates improved communications, engagements, and coordination between the federal government and Asian American, Native Hawaiians, and Pacific Islander communities throughout the United States and in our protected territories. Ben?
As career civil servants, we at the RN are building relationships between our government and the AA and NHPI communities by coordinating outreach efforts and connecting community stakeholders with federal resources. We live and work in the communities we serve in and are proud to be the on-the-ground connectors and problem solvers for our diverse community. Established back in May of 2013, the RN institutionalizes a very powerful community engagement mechanism and takes the federal government to the AA and NHPI community and into the farthest corners of our country. The regional network's engagement strategies have strengthened over time through localized feedback. Although the AA and NHPI communities share many of the same challenges we hear about at the national level, as many of you know, the AA and NHPI communities are often hard to reach or even fearful of government, and each community has their own unique issues and needs. Through in-person convenings, the regional network has conference calls, virtual events, and coordinates with the community to lead local roundtables and technical assistance programs across the federal government, sharing best practices and challenges with the AA and NHPI community, build relationships between the federal government and the local communities, as well as collaborate with state and local and AA and NHPI commissions and elected officials. We share information about federal resources, programs, and employment opportunities, as well as solicit community feedback and recommendations on current and systemic issues. We assess the capacity and building needs of the AA and NHPI community organizations and explore opportunities for engagement with philanthropic organizations and provide recommendations and guidance to WIANPI that are included in the annual report to the President. And importantly, we work closely with each of you to implement recommendations of the White House Initiative and the President's Advisory Commissions on AA and NHPIs.
Throughout the years, the regional network has convened countless events, technical assistance sessions, trainings, and other workshops in cities across the country, from Atlanta to Des Moines to Portland to Honolulu, reaching thousands of people. Topics of discussions have ranged from addressing anti-Asian hate, healthcare, small business, the environment, veterans affairs, vulnerable workers, and so much more. The community response has been overwhelmingly positive, especially in areas where community leaders are engaging with federal officials for the first time. Through these efforts and recognizing the tremendous growth and unique needs within the AA and NHPI communities, the federal government has made great strides to improve the lives of workers, families, businesses within the community.
As you can see, the RN is uniquely situated to be the primary link between the federal government and the AA and NHPI community. Through our personal experiences and engagement, we understand the unique concerns and issues of our diverse communities face. In order to do the work that we do and stay connected, in addition to Paul and I, each federal region has a regional network lead or co-leads to meet the needs of the AA and NHPI community. These long-standing federal career employees are key to the community engagement and rapid problem-solving abilities of the RN. The regional network convenes monthly calls with our leads to share best practices, discuss challenges, and ways in which our community can work together. Going forward, we're excited to work with each of you to strengthen our engagement and increase our impact within the AA and NHPI community.
This approach and the regional network are a model of effective community outreach for the federal government. Currently, we are at an all-time membership high of over 400 individuals from more than 20 agencies and sub-agencies. These diverse members from throughout the federal government proudly count themselves as WIANPI Regional Network members, and that number is growing. The work we do perfectly complements this commission and interagency working group that you heard of earlier. We look forward to working with all the commissioners on our engagement efforts.
We believe in the work that the regional network has done and our advancement of equity, justice, and opportunity for all AA and NHPIs. It's an honor to welcome each of you here today, and we're excited to work alongside you and build on the good work that has been done and look forward to working closely with each of you to support our community for years to come. Commissioners who are interested in connecting with the regional network, we look forward to that engagement. There are many familiar faces on this commission, and we know each of you have dedicated your life's work to support the underserved and underrepresented. Please bring us your ideas, thoughts, and experiences so we can work together and better serve the AA and NHPI community. Emmeline, Rebecca, and the WIAMPI staff are your connection to us here at the RN. Please work with them to coordinate our engagement. And please know that the entire regional network is eager to welcome and start working with each and every one of you. In closing, we'd like to share some images of our past engagements through the years. And if you look closely, you might see some familiar faces. And we're going to use the rest of the time to answer any questions that you may have. Again, on behalf of Paul and myself, welcome and thank you. And let's get to work. Next slide, please. Oh, I think we've got the next slide.
This is our 10 federal regions.
So you'll see that through the 10 federal regions, there are, as Paul and I mentioned earlier, there are, for each of these different regions, there is a represented lead. In some cases, there are co-leads. So there's two folks that are representing certain regions. List of those individuals and contacts are available on the WIAMPI website. And again, as we look at that targeted and coordinated approach to tackle issues, we can connect locally and through the efforts of the regional networks to be able to combine and coordinate our efforts to tackle those issues specifically. Next slide. Oh, next slide.
This is us with the commissioners in the past. And as you can see, the commissioners all interacted with the regional network on very closely. The reason being is that the regional network is the on-the-ground federal agencies. There's over 450 federal agencies in the executive branch. And we're your connectors.
Next slide.
These are these are more recent events that we are holding during COVID. Since we can't really meet in person, we do that virtually. You might recognize some of our folks here. Next slide. We've done outreaches in various areas. We've especially with commissioners. We have regular meetings with our commissions in the past, and also we also do events in other parts of the country. This event on the right is done at Salt Lake City, Utah. We do listening sessions, but also this was during the Affordable Care Act enrollment period. Next slide, please. On the left-hand side, you'll see our interactions with our communities when we were pushing out for the World War II film vets, immigration policy issues. On the right, we have our Filipino Worker Center partnerships with the Empleo Pinoy program. This is addressing vulnerable workers issues. Next slide. Regional network work with commissioners on aging. I saw Daphne here on the line earlier, and we work with. We did in the middle screen is a shot of our cultural awareness training. This was done during when we recognized and we noticed a rise in anti-Asian sentiments during 2019. We wanted to train first responders on issues affecting the Asian community. We had Chinese, we had Japanese, we had Korean, Thai. We had the Sikh community, we had the Pacific Islander communities all coming together to educate our first responders. These are, and to the right, we had listening sessions in Hawaii, Honolulu, Next slide, please. Our regional network meeting with the Nepalese community in Atlanta. We did capacity building partnerships throughout the country. This was taken in Boston, Massachusetts. Regional network listening session and meetings in Los Angeles with listening into the NAPCA, which is with issues affecting seniors. Next slide. Our community roundtables in Guam, again, grant writing, capacity building. These are all things we've all done in the past, and our commissioners have always been integral partners in that. Next slide, please. Listening sessions, youth forums, everything has always been. There's really nothing. No topic is off the table for us, and just keep in mind, we depend on our commissioners to work with us in the field as well.
Paul and Ben, sorry, do you mind if I cut you a little bit short here, because we've got some time for questions, and I want to make sure we can get the questions in.
Let's jump right in.
So sorry
Let's
about
jump
that.
No, let's do it.
All right.
So as you see, the lineup of questions has already started, and Carrie, I know, asked a question in the chat, but I'm going to start with Dr. Kamala at the beginning, and then we'll sort of go through the questions. I know there's a lot of them for you. Shout out to you, Kamal.
Hey, Paul. Hey, Ben. Pleasure to chat with you guys, and hope to do it in person soon. And please just call me Kamal, unless I'm prescribing something today. I guess we may need it. Yeah. I guess this is sort of a general question for both of you guys, and maybe to Sonal as well. Are we exploring perhaps creating an incubator for the types of work that you guys are describing? And then through the incubator, it may be just a better way to sort of create the pipeline for the types of products that we're looking to roll out.
If you want to jump in, if not, I'm
Ben,
happy
why don't you start, and then I'm happy to chime in.
Yeah, I think as Paul pointed out, there's really nothing that's off the table as far as engagement and initiative working within the parameters that we've got to be able to do it. And I think that we have the infrastructure, as Crystal pointed out earlier, to build on some of these things that have happened in the past. And there are some ways to be able to create infrastructure. We've got some great partners within the community to be able to work with and leverage. We've got folks like yourself who have longstanding relationships to be able to create infrastructure to be able to have a continuous level of service for folks. So I think we have the ability to create that. The great thing about the regional network has been that it into itself is incubating resources. And I'm actually going to try and tackle Carrie's question at the same time. We have had successes by the continuum of the regional network throughout across administrations and across changes in administrations and whatnot. So we have an ability to continue the resources and continue the work going forward. This is the first time that the regional network is actually in the EO, which we're super excited about under this administration, to be able to be fully recognized and have the full force and the resources of HHS behind the good work that we've done, and as well as doing going forward. So I think, Kamal, absolutely, there's some opportunities to be able to engage and create mechanisms to create a pipeline and continue this, as Crystal pointed out, for years to come.
I have nothing else to add, so I'm going to go on to Smitha.
Thank you. So I appreciated hearing from both of you, Ben and Paul. I loved the fact that what I saw was as we're talking about things to happen in the commission, and Crystal made just a fantastic point earlier about how important it is to have things that sort of last and are implemented. And one of the things I saw in some of the slides you just presented is the implementation piece, it seems to me a little bit. So I was curious how, as we do, I know, for example, the first responder one jumped out at me because several people have in the local area in the Midwest have been talking about how do we engage, how do we communicate with people of these diverse backgrounds, and we want to be respectful, we want to be thoughtful as we're supporting different constituents. So how do we make that connection, or how does, can we do that locally? I saw you did it in another community. Tell me a little bit more about it.
So may I get this? Okay. This thing actually all started organically. We saw some rise in anti-Asian hate, but it wasn't just directed to the Chinese community. It was directed to our Sikh communities. It was after an attack with our Sikh communities, and it was our Muslim communities as well. So we gathered our resources and said, we knew our community they're suffering, but we also wanted to train our first responders to address these issues. What we gathered was talk to some community leaders. We had the FBI. We had the training. Bring in just so many partners. It came in very organically because we knew we had so many people in our community interested in this, in giving presentations to our government officials to tell them this is what you need to be aware of. And we had so many, it became very, very sought after from the federal agencies, but also now the state agencies as well as our local agencies got a wind of it, and they wanted to be involved in it as well, to listen in. So these things coming in, when you bring a topic like this, it just develops organically, and it can and through the convening power of the initiative, we can make this happen very quickly and do this very extensively. Ben?
Yeah, and I think, Samhita, to just echo Paul's comments, that last part there, the convening power of the RN, to be able to bring it into communities that are looking for this information, as you're aware of different areas, that's where the leadership of the commission is key. We continue to do it on the federal level through our federal employees and folks, but where our commission sees gaps, where our commission sees for us to present this information and the different resources that you hear about us doing, that's where we're going to be able to work together and be stronger and be able to have a greater impact, because each of you brings so many different resources to the table, as well as voices in areas that may not have been able to be reached before. So it's going to be exciting to work with each of you to be able to push these efforts forward.
Thanks, Ben. Thanks, Paul.
We're going to cut into our 10-minute break just so we can get the last two questions. So, Victoria, do you want to go?
Yes. Hello, Paul, and it's good to see you again, and Ben. And I know just kind of witnessing the Region 4 work, it was phenomenal, just kind of on the groundwork. And I just kind of the re-engagement and reconvening of like the Region 4 work under the UNTITLed. Are there any plans to kind of recreate that directory? I know that was something that was sought after, like was really an amazing tool kind of in Region 4 for people to connect. And then what are some of the kind of initial launch goals, right, of how this is looking in all of the regions as people kind of re-engage the regional network, if they were not active just during the past administration? Because I'm really looking forward to seeing how our different regions or the groundwork is going to reconnect, and then figure out how to advocate and build some of the capacity on the ground.
Ben and Paul, can you just wait 1 second? Can we also get Kai-Ying's comment so you can take both of them together? Just because we do have the next presentation starting at 3:20, and we want to make sure we're on time for that. So Kai-Ying.
I'll just be very brief. Thank you very much for the presentation. I'm not familiar with the regional network because I'm a nonprofit leader and organizer, but I just want to share that since you're both located at the U.S. Department of Labor and Small Business Administration, that during the COVID, we had a lot of issues with community businesses accessing any of the funding coming from the federal level and even through SBA. And so I think that for us, it was an intersection of lack of understanding of information coming, or the information was coming so quickly that it was very challenging for small businesses to apply for any of the funding. The second is a language access issue, right? I mean, for example, small nail salon businesses, I mean, even though we have information translated into major languages, many of the small nail salon businesses are owned by Vietnamese people. And so we had to work with our own Department of Economic Development to say to them that they have to translate some of the health guidelines into Vietnamese specific languages. So I don't know what work you're doing now, but I would like to see more of that happening because there's so much funding coming from the federal level. But when it gets to the local level, it's not distributed equitably. And so then it's a lot of hardship on the local nonprofit organizations to be advocating. But I think that there has to be strategies for us to do better and to work closely with all of you. So I just wanted to say that. Thank you.
And that's why your engagement on the commission is going to be so key. Right? Bringing that voice, bringing that opportunity to be able to help us better serve the different communities that are out there. Specifically with nail salons and throughout the COVID crisis, the regional network as well as our local community efforts have been directed towards that. We had federal agencies, specifically ours, that translated the information into Vietnamese. Paul and I worked together with the regions to be able to do small business events in Vietnamese as well as other languages throughout the country to be able to make sure that language access was a priority. And as I think you heard Crystal say earlier, language access is a key priority for the initiative going forward, and something that we're going to be working very diligently on, as Kamala pointed out, to be able to put some long-lasting changes and implement some resources to be able to make sure that that continues. Working with the region, Victoria, and making sure that folks have access to not only information, but government employees and resources to folks to be able to access services is a key priority initiative for us. And it has been throughout the establishment of the RN. We connect the federal resources to the community. And that is one of the big things that we're going to be able to continue to do. And I think, Victoria, you pointed it out, that list and the engagement, as Paul pointed out, has grown. And the amount of interest and the amount of folks that are interested in engaging and doing this work is at an all-time high. And I think that with your guys' active engagement and with our continued collaboration between us, the IWG, the other WIOMPI initiatives, we're going to be able to make a long-lasting, sustainable impact that can really create impact and change. And remember, both Paul and I are here in Los Angeles, so we answer to Kerry, and he's all about making impact and making change in the community here. So we're all ready to get to that work and get it done. And under your guys' leadership and guidance and ideas and resources, we're going to be able to be that much stronger and that much better. And I know we took up more than we should have, but I appreciate it. And we, both Paul and I know, look forward to continuing the conversation going forward.
Ben and Paul, I just want to say thank you so much. This was such a great presentation, even for the short amount of time we had. But just to all of us and as commissioners to remember that the regional network is a super important part of the work that we do. And that is really the touch for all of our communities to be able to both get information of what's working, but also connect more directly into the federal government. So thank you all for what you're doing. We have literally 4 minutes because we have former commissioners coming on to give us input on what they learned over the years. So please come back here by 3 minutes now, by 3:20. Let's take a bio break and come back. Thanks, everyone. Well, welcome back, everyone, and thank you for your attention to our past speakers, our past discussions. It's been fantastic. We hope that everyone's beginning to see sort of the breadth of this initiative to advance equity, justice, and opportunity for AA and NHPI communities. The Commission, the IWG, the regional network are all different ways and yet collaborative to reach this goal that we have that has been set for us. But it is my pleasure now to introduce our next panel on opportunities and lessons learned from past commissioners. These are just incredible leaders that have just been in our communities and have walked the walk for many years. So we have a lot to learn from them. And they have a wide range of experience and expertise they'll share with us and provide food for thought as we sort of move forward on our work. So let me first start with Tessie Guillermo was appointed to the Presidential Advisory Commission on Asian Americans and Pacific Islanders by President Clinton. She is currently the chairwoman of the board of Common Spirit Health, the largest nonprofit healthcare system in the United States. And I was lucky enough to have dinner with Tessie a few weeks ago in California. Ms. Daphne Kwok was appointed by President Barack Obama and served as the chair of the President's Advisory Commission on Asian Americans and Pacific Islanders. She is AARP's Vice President for Diversity, Equity, and Inclusion, Asian American and Pacific Islander Audience Strategy. Dr. Tung Nguyen was appointed to the President's Advisory Commission on Asian Americans and Pacific Islanders by President Obama and succeeded Ms. Kwok as commission chair. Dr. Nguyen is a physician researcher and professor of medicine at the University of California, San Francisco. Ms. Chilling Tong was appointed to the Presidential Advisory Commission on Asian American and Pacific Islanders by both Presidents Bush and Trump. Ms. Tong is the president and CEO of the Asian and Pacific Islander Chamber of Commerce and Entrepreneurship. It's such a pleasure to have all of you here. Thank you for your work on the commission, and thank you for joining us today, because I think your insights are going to be very important for us as we move forward. So let me start with a question to all of you, and we will have questions for commissioners to ask each of you at the end of this. Given your past experiences, what are ways for the commission to be most effective? Tessie, I'm just going to go across my screen since you're the first on my screen. Would you mind going first?
Sure, no problem. And thanks. And wonderful to see you and meet all of you on screen, and great to see some of my good and old friends on the commission, and congratulations to you all. The times have changed so much since the first commission was in place. And so the ability to be effective, I think, kind of goes along with the times. And so I think the most important thing, and you just had the panel on the regional liaisons and the work that can be done regionally, between then and now, my advice, my sense is the most impactful ways to be effective really do happen at the local and the national level. And so that constituency-driven representation, listening to what's happening on the ground then and translating that into sort of a power base that goes from the ground up really is what stands the test of time. So, just sort of generally in a nutshell, that's what I would recommend, and happy to talk more about it later.
Thanks, Daphne. Thanks, Tessie. Daphne?
Well, thank you so much, Sonal. And congratulations to all the commissioners. And as Tessie said, there are a lot of good friends here, and then there are a lot of new friends here. And we very much want to be of assistance to you throughout your tenure. And I'll say we're probably all very jealous of you that you get to serve during this very, very important time for our nation. I would say what Tessie said was extremely right. The regional at that local level, and all of you are representing communities at that local level, is so very key. And so I would say, and just picking up on Kai Ying's point about getting to know the region and her area, how important it is to connect with career staff at that local level is very, very key, as well as the work that you're doing at the national level. I'd also say that you really are the ears and eyes of the administration down on the ground. ground. You are the conduit from the community to the administration and vice versa. And I hope that you'll use this opportunity to really continue to empower and engage our community, even from the time that we served till now. I'm so proud of the community that we have really advanced in the area of empowerment. And so I think that for you to be able to inform and educate and engage our community so they get to learn the process, have them be part of the process is going to be so key as we continue to empower our community. And so those would be the two main points that I'd like to share.
Thank you, Daphne. Chang?
Thank you, Sonal, and congratulations to all the commissioners. I was just trying to remember what it was like when I first got appointed to the commission. And I actually came on a couple of years later than the first Obama commission, and I was pretty overwhelmed. Felt like it was a lot of stuff to do. And in a sense, you were at this sense of being a kid in a candy store. It was just so much stuff. I mean, it was so much good stuff. But it took me almost like a year to figure out how to make it work. And as proof of that, they gave me a remedial appointment to the second commission because I didn't get it done right, so I got to do it again. But I will tell you 4 things that I think are really important, and we can get to details if we want. I think what I figured out the role was that we are going to be the mediator between the community, the White House, and the federal government, as seen through all the departments and other offices. And these problems that we're all trying to address can't be addressed without collaboration and coordination. And in many ways, the commissioners are the connector between those 3 elements. Second, I would advise the commissioner to pick some key issues to work on. I'm sure you already have your key issues. And of course, you want to work on the issues that you're passionate about, but also think about other topics on which you can have influence, because otherwise you don't want to limit yourself and your influence, particularly when you're talking about structural issues. And what I mean by that, I'll talk about later. Third, I think it's really important for us to work very closely with the staff. So in addition to the usual commission meeting, there's going to be meetings between you and staff on particular topics. And that's actually where I think a lot of the work gets done. The commission meetings are nice and of course very important, but the work really gets carried out when you're not together as a whole commission. The one thing that's really important about that is when your staff's working with department heads, particularly people who are very high ranking, you actually are the ones who carry the influence, not the staff. The staff are in the federal government are at a lower level than the people they're talking to in the department. So I think you need to be there for the staff. And then finally, I'm glad that the regional network went before us, because I thought that was a brilliant innovation. This is the way that commissioners get to really feel the impact. I don't live in DC. I don't get to go to meetings in DC all the time, which you really need to if you are there. But this is how I get to engage with the federal government and bring my influence at the local level. So really encourage you to really connect with the regional network leaders in your region and work very closely with them. Thanks.
Thank you so much. That's such great advice. Chilling.
So no, thank you for your invitation and leadership. I really want to congratulate all the new commissioners for your first public meeting. How exciting. And what a great agenda and discussion today. The President's Advisory Commission on AAPIs has established great credibility when it was chaired by Secretary Norman Mineta in 2001. Since then, the commission has consisted of outstanding business and civil leaders who deeply engage with our community, like all of you. And we are especially excited that the Secretary Behera and Ambassador Tai, as a commissioner's co-chair, of course, as Crystal to serve as executive director, it's just such a wonderful dream team. I think both the Commission and the White House AA and NHPI initiative need sufficient resources and a strong support from the White House and host agency like HHS in order to be effective. I'm sure they will. And each commissioner plays a significant role to advise the president on ways the public and private and nonprofit sectors can work together to advance equity and opportunity for every AA and NHPI community. It will be critical that the Commission maintain strong lines of communication across all federal agencies to ensure that each one is working in tandem on how to best serve the AA and NHPI community. The regional network plays a significant role. The co-chair Ben and the Paul has done a great job, but I really wish Commissioner can also, to engage with them too. I think the community will also like to see Commission open to hearing from voices across all sectors and to be inclusive of all NHPI subgroups as possible. As Daphne and Tessie has mentioned, local. It is just so critical to engage a local level. And it's also be important that Commission frequently reach out to the community for data, research, and surveys related to the AA and NHPI communities. This action should be included in broader discussions about equity. Another very important task is the presentation of the report to the President. It is never too early to start the preparation. Time flies. And the administration would respond to the report within a limited time period, and as well as to involve the commissioners in advance in relevant policy discussion. We really applaud the Biden administration's efforts to uplift a diverse set of leaders throughout the administration, and it's created a historically diverse administration in which 15% of all appointees identity as Asian American and Pacific Islanders. I personally really applaud Erica Morosugu's great leadership and appointment. But at the same time, we urge the Commission and also administration to continue advancing AA and NHPI leaders and to set an example for the private sector to do the same. And we want to, to have a commission, hopefully outreach to young AA and NHPI leaders to deliver key messages through all the different social media. Thank you.
Chang, thank you. Thank you all so much. I'm going to ask specific questions of each of you, and then we're going to open it up to everybody. So Daphne, I'm going to start with you. And anti-Asian hate is really at the top of mind, and it is something that it's been around for a long time, but it's since 2020 it's increased, and we're seeing it even continue to increase. So, what do you think this commission should do or can do?
Well, I think what's great is that there is a very strong mandate, right? And especially with President Biden's passage of the COVID-19 Hate Crime Act as well, too. And so I think one of the things, too, is we got to use our bully pulpit, right? Your bully pulpit, to be able to continue to make this and make it known that this is still an issue. I think people say, oh, it's gone, it's no longer an issue. But unfortunately, as we all know, we're hearing about incidences every single day. I think it's also important about the enforcement, right, of hate crimes laws. And we have to remember that the collection of hate crime data by local law enforcement is not mandated. So the numbers that are in the books is certainly not a true picture. And so I think one of the things is to really push for mandated collection of hate crime data. As we know, data is everything. If we don't have the data to prove that these cases are happening, it's not going to help. So I think that that's one of the things. The other thing is that there are several major anniversary dates, unfortunate anniversary dates that are coming up. The one that's coming up very soon, March 16th, the Atlanta first anniversary. June 19th, the 40th anniversary of the Vincent Chin murder, which was so seminal for our AAPI history. And so with these opportunities, unfortunate opportunities, is the continued opportunity to continue to inform and educate. And I'll just close by saying the concept, and I think it was Crystal who talked about it, belonging. I'm really starting to latch on to that concept as we talk about, DE&I, but the belonging is so fundamental. What can we do as a nation to ensure that all of us truly belong to this nation? And I think we see some great movement right now, especially in curriculum at the K through 12, as we've seen Illinois pass mandatory Asian American studies, New Jersey, Connecticut, California, and others down the line. So I hope that we will also focus on belonging as well. And the working coalition outside of the AA and NHPI community, but truly working in coalition with other, especially communities of color and the LGBTQ community as well.
Daphne, thank you so much. And I know Crystal had mentioned also working across the different groups across the government. So I think this is the collaboration, coordination is so important, but also just recognizing that there's an opportunity here with the very unfortunate anniversaries to actually push through. Tom, in reviewing the past reports and recommendations from former commissions, I noticed that the data disaggregation language access has been consistently a question that has come up. Do you have insights or recommendations, and how do we actually get moving on this? What do we need to do?
Yeah, I'm glad I'm following Daphne in that question, because actually I'm going to link that question to this question. And we'll start with anti-Asian hate and racism. You know, we know that racism comes in all sort of flavor, from the individual acts, which is the one that gets everybody's attention, the insults, the violence, and the murders. But also there are structural racism issues, right? And I think we have to address both. And so here's my structural equivalent for the individual behaviors. You all look alike. The structural equivalent is we don't have any disaggregated data for you. Learn to speak English. The structural equivalent for that is we don't give you language access if you don't speak English. You are all not good enough. And the structural equivalent lies for that is that we don't have workforce diversity, particularly at the leadership level. So I think as a commissioner, I think you have the opportunity to look at all of this from all angles. And I think that's what, so when I said the candy store, I think that's what I meant, is that you can fix the individual and you can fix the foundational issue behind this. And fundamentally, clearly, anti-Asian racism is probably the topmost thing, but you can work on workforce diversity, on disaggregated data, and on language access within that context too. So I wanted to at least emphasize that. And when I talked about things that you can do besides the topic of interest, these are the things that I'm talking about. Because underlying every single topic that you care about, whichever they are these issues. Okay, so you can't solve, you can solve a particular policy issue, but you can't solve the underlying reasons why that policy issue came up if you don't actually address these issues. And to do so, I think the commissioners, I think, have to be advocates in the government. And by being an advocate, what I mean is do what you already do as advocates: be loud, be clear, and be repetitive. Say it over and over and over again. I bring this up at every single meeting, and actually, it's much better when it's brought up by the other people in the meeting, not me. But if it doesn't get brought up, it gets brought up. They need to understand, whether you're meeting with a department head or a frontline staff of a department, that this is important, and we're going to keep on hammering on it until they resolve the issue to our satisfaction. I think we have to hold people accountable in private and smaller meetings, and in public meetings we have to ask the hard questions. We cannot back away from this. We've had this problem with lack of disaggregated data and lack of language access ever since this government has existed. So there isn't any reason to think that it will get better unless we push really, really hard. I think for all of you, you can bring any experience you had in creating interim solutions. For example, very small example, I'm a researcher who get funding from the National Institute of Health, and when we were on the commission, they took away any possibility of having any Asian Americans as part of their diversity efforts. And then the justification was that Asian Americans are overrepresented. And what we did as a group was to go back to the NIH using my hat as a commissioner, because I'm from the White House, they'll meet with me. And I said, well, there are, if you look at disaggregated data, some Asians who are not overrepresented. So you have to at least, put a mechanism in there where that's actually addressed. And they actually did. So small example, interim solution, but a commissioner can actually get people to the table that I, as a researcher and a professor of medicine, cannot. And so I would leverage that very strongly. I think, thinking creative with the staff and the departments, and then bringing the community whenever needed. The other thing that came up that was really interesting was there's a cost issue with disaggregated data and language access. We need to think creatively with our technological partners about how to do this, because sometimes the answer would be like, we have no money to do it. And we may be able to come up with a technological solution that's also an interim solution, but at least we can do that. So thanks.
Yeah, it's super helpful. And I think the points you make actually also lead back to Daphne's point about belonging. So it sort of adds into how do we create belonging, and these questions and the points you're making are super important. And again, to my colleagues, I think this is one of the more important things of how do we use our power effectively as commissioners. Tessie, There are many issues raised in the 1990s when you were on the commission and during the Clinton administration that continue to be barriers for AA and NHPI communities today. Do you want to just talk about a few of them and things that advice you might have?
Sure. I went back and reviewed the first report that we issued in 2001. The reality is, all of those issues then and now, they're formed over decades of experience that our communities have faced, in terms of, racism, xenophobia, lack of political power, social injustice, and so on. So, as groundbreaking and ambitious as the first commission and the initiative was, and, I still have heartache in terms of how long it took to actually get it done, even as we raised those issues. But, they weren't going to get solved in, a presidential term, nor solved in the 20 years since, right? So the issues aren't new, and in many ways they're more complex, right? So our role at the time was really to bring for the first time sort of a consolidated attention on a national and federal level to these issues and to these injustices and to these concerns that were identified and prioritized by the communities themselves, not from a top-down sort of treetops, disconnected spokes group or spokesperson. And so that process was really, really important. And then to embed them in the institutions that existed at the federal level. And I'll admit at the time, our focus was primarily at the national and federal level, because that's the opportunity that we had. But it was to build a foundation, and embed those, for the solutions and dialogue and accountability for the future. So data collection, language access, civil rights protections, inclusion, capacity building, funding, all of those things, they existed then, they exist now. Now it's a matter of sort of scale and scope, right, and prioritization. And then, obviously the COVID pandemic has just exacerbated health disparities, for instance, and the experiences that we've had over the last years with the heightened visibility around anti-Asian violence have also just called much more attention and accountability, I think, to any entity that has responsibility in the public for addressing them. And those barriers all still exist externally. But I think internally we have a lot more barriers than existed then. And if I could just list, you are all obvious, they're obvious to you, but, we have greater diversity than ever before, right, in our communities. We have generational differences. I mean, it's been a generation and a half that has passed since, 2000. And this generation that exists now that is claiming power, they can't wait, and we can't wait, for them to give them a seat. They need to be driving things now, right? There's technology and geographic divides that are heightened, a higher degree of fragmentation, and a higher degree of expectation for results sooner versus later. So, one of the pieces of advice I would have is, I don't know if it's controversial or not. I mean, it would have been controversial back in 2000s. Don't spend a lot of time trying to build consensus. We know the issues. And at the local level, they have emerged and they've been articulated. So I think right now we have to focus on a balance between process and swift action, right? Take advantage of the time and the visibility and the positioning that you have both as individual commissioners, as Chang demonstrated, being able to say, I'm from the White House, I've got this issue, I'm going to go and force some action on it. And so, building power and taking advantage of your issues at the local and regional level is important. But I also think that what we didn't understand back then was really internalizing and understanding the role of the private sector, and now even more so, what role they have in moving policy funding dollars, all kinds of attention today versus back then. So really those leveraging our economic power as both consumers, as business leaders, as civic leaders, strategically is really much more important, I think, today, and we have the tools to do that. Popular culture. I mean, it's not just about the visibility that we've had around the acts of anti-Asian violence, but it's also the rising popularity, the rising understanding, the rising immersion of Asian cultural practices, behavior, and so on, that I think we really can take advantage of, whether it be, food, movies, media, all kinds of things that we can leverage those who are willing to act as leaders in their sphere to do that. And as Chilling talked about, social media, digital technology, those kinds of things we have at our fingertips, and we can leverage this generation of Asian Americans, Native Hawaiians, and Pacific Islanders. They know how to leverage that better than our generation did at any point in time. And so all of those create opportunities for progress that didn't exist in 20 years ago. And to the degree that they do today. So that would be, sort of my statement in offer to the commission today as you begin your work.
Thanks, Tessie. It's important to recognize that this is, we're always building the building blocks, and as we strengthen those building blocks, we can keep doing more and keep pushing for more. Chilling, Tessie sort of got to this point about on economics, and I want to just talk a little bit about economic equity. We've seen the AA and NHPI communities and businesses have been disproportionately affected in COVID, and along with the rise in anti-Asian hate and xenophobia. What do you think, given your experience, what do you think we should be doing on economic equity?
Yeah, unfortunately, COVID and anti-AAPI hate still greatly impact our AA and NHPI small business community. Our organization, National AIDS, conducted 2 national surveys in partnership with U.S. Black Chamber, U.S. Hispanic Chamber, and measure how COVID-19 affected AA and NHPI, and also minority-owned small business. We find that 1 in 3 female AA and NHPI business owners experienced direct racial bias and discrimination, and 84% of business owners reported that the COVID-19 has had a negative impact on their business. We also find that 36% of the incidents happened at the place of business, and a disappropriate number of attacks have been direct at the AA and NHPI women business owners. Well, recently we have seen actress Olivia Munn reported that her online call on stopping AAPI hate was Zoom bombed with racist pictures and audio. And also yesterday, NBC News reported anti-Asian hate crimes increased 339% nationwide last year. So, to combat anti-Asian hate, anti-bias training program, should be integrated into diversity, equity, and inclusion efforts among federal employees, and also private companies can be encouraged to implement the same policy within their own workforce. We also then learned that a significant portion of AA and NHPI small business owners, I would say 61%, did not have access to federal relief program because some language barrier, like a PPP elder loan during the pandemic, because they don't think they are qualified and they find the application process is complicated, or they are unaware that aid was available to them. So for AA and NHPI business owner, access to capital, access to contracting opportunities, access to technology are still very challenges. And right now, like many others, the AA and NHPI business community is feeling the impact of supply chain issues. One of the business owners based in Washington was in danger of having their product dropped from Safeway, Kroger, and Costco because their containers were stuck in the port Seattle for over 2 months. So this is an ongoing issue within minority community, particularly among AA and NHPI. That said, it's important to use the reach of this commission and also other Asian American Chamber of Commerce and business organization to amplify this form of relief and other important resources. During the pandemic, because of CARE Act grant, National AIDS received a grant to help more than 17,000 business owners, and were able to continue the program through private contributions after the NBDA funding expired. So it is so critical have a commission to inform all our community, especially business community, the federal resources there and our community can utilize. Thank you.
Thank you, Chang. I have to say, I feel like this panel could go on for another hour and I still wouldn't get enough information because I think Chang put it well. It's so overwhelming at the beginning that you're sort of just absorbing this information. I'd like to open up to all of our commissioners to ask questions of each of you. I've sort of run through base questions, but I think there's a lot here. And I just want to thank all of you for making the time to talk to us and hope you'll be available to us as we sort of move forward too, because I know you've got a lot of experience that you can give to us. So anybody, my colleagues, please do raise your hand and we'll make sure we can get you to ask any questions you have. Go ahead, Kevin.
Thanks. It's not really a question, but I just wanted to comment that Dr. Tung Nguyen's framing of what structural racism looks like for the AA and NHPI community is one of the best ways I've heard it described. So I just wanted to thank him for that.
Kevin, I have to say I was taking notes the whole time he was talking, so I 100% agree with you. I know somebody had just raised their hand and they put it down, so I apologize. Teresita.
Yes, I really appreciate what Tessie was saying about let's not waste time about building consensus. I know everybody wants to build consensus, but it just feels to me like so many issues are in our faces right now with a divided country. But I am concerned that we have such a long list. So what I would like to ask the panelists is which top 2 or 3 issues do you think we should be tackling? And I'd like to hear from everybody on the panel.
Well, maybe I'll go first. Oh, oops, Tong.
Sorry, you're my chair, so you get to go first.
Okay. So I would say the impact of COVID, absolutely, right? And the anti-Asian hate. I think the two of them, the double pandemic, as I call them, right? As it impacts our community, especially for our elders. And I hope that that is a subgroup that is really raised in priority, the impact, the social isolation, the mental health of our elders, as Tong knows all too well, is really been very detrimental. Those would be the two.
Can I go, Sana?
Please.
Yeah, so there's obviously many things we can work on, but from the standpoint of where I sit, the biggest issue is misinformation, disinformation, particularly not just among Asian Americans who speak English, but those who don't. And you can see that the disinformation, misinformation has caused a lot of problems on the health side, right? So with COVID, people are dying from it. But it also causes problems in many, many other places as well. And one of the things I was talking to some of the staff about is the idea that we need to have better information, not just about health and COVID and all these other things, but also better information about what it means to be AA and NHPI. Because I think most of our community don't actually know the history of AA and NHPI. They don't understand when we talk about racism. Like a lot of people who just came here may not know anything about racism because they haven't experienced it. They live in a community where they're protected from it, for example. Hundreds of years of anti-Asian and Native Hawaiian and Pacific Islander hate has caused us to be where we are. We need a better understanding of what history is. We need a better understanding what the model minority myth and why it's so toxic to us and to other people of color. So I just hope that as a commission, commission, you all decide to participate in community engagement on the topic of misinformation, disinformation, in the topics that you care about, but also in the general history of the movement and how we got here. Like the fact that we used the term Asian Americans, that would have been unthinkable, 50 years ago, because nobody knew what an Asian American was 50 years ago. So things like that. Thanks.
I totally agree with you. From economic point of view, as I mentioned, access to capital, access to contracting opportunity. But personally, I think education plays a key role in combating anti-Asian hate and promoting inclusion. Anti-Asian hate and xenophobia in general stem from a tendency to alienate members of the AA and NHPI community rather than viewing them as Americans who belong. Most Americans are taught very, very little about the Asian American and Asian American history, are unaware of the significant contribution they make to American society and to the economy. This goes back a long way. AA and NHPI fought in the war, built the railroads, fueled California's gold rush. Education must go beyond what is covered in AAPI Heritage Month. I really believe that this is a joint effort, and we should teach the general American about what our contribution to this country.
I would agree with that. But one of the things that I think would be really sort of opportune and important for this commission to be able to do is to really sort of corral the energy and the ability of this generation of activists and advocates and leaders into the actions that you're going to take on any issue. Generations are changing quickly, and we've got a generation of young people who not only don't know all of the history of our Asian American, Native Hawaiian, and Pacific Islander communities, but they are characterizing themselves quite differently than we did. Right. So to the extent that we want to educate the public, the general public, on what does it mean to be Asian American, Native Hawaiian, and Pacific Islanders, at that time, we've got a generation who are defining it even differently than we would in terms of the history that we're very familiar with. And they're going to activate around that. And they're going to be the ones who are really going to change the institutions and build the institutions for the future. So finding ways to really have that leadership and the issues and the way that they define the issues and the solutions is going to be really important.
Thank you all. I see Smitha put her hand down. So Grace.
Oh, sorry, I need to unmute. So I have a question around, how the Commission in the past and any recommendations you have for us address the topic of immigration and migration, given that intersects with all of the pieces that you've been talking about, and I see it from the intersectional lens of the hate that our communities are perceived as the perpetual other, and the fact that my perspective really is that the system, the immigration system is broken. And so I'm curious, any recommendations or thoughts you have on, how that's been integrated and whether there's pieces that you feel that we need to move forward. So.
I'll take a crack since the ones that, there are many things that you're going to be confronted with in the commission that you want to solve. And the commission is a place where you can solve some of it, not all of it. and I think the thing that I learned the most about the commission was because I was always thinking that the government was going to solve my problems or our problems for us and my problems for me. Once I got into the government, I realized, no, there are many problems that even, department heads and all these people can't solve. And so the most important thing is to identify what the sort of the barriers are and then think about the appropriate solutions. And some of those appropriate solutions are actually in the government and where the commission has some influence, and there are other places where other things that can only be solved outside, and that's when I go back to the community and work with my community on how to solve it. So just a very broad, generalized answer to that.
Smith, I'm going to take the last question. Kamala, maybe both of you can ask, but I just want to, because we're going to cut into a break again and we didn't have a break. Is that okay? Okay, so Smith, I'm going to let you go. Oh, you put your hand down.
Sorry about that. Thank you. I'm going to be quick. First, Sonal, I go with the Smita as the pronunciation of my first name instead of Smita. I just want to thank all of you for, all of you have brought so much to our discussion today. As expected, with 4 different presidents, very different viewpoints or different contributions on how we can engage the community, and also valuable. So I really appreciate everything that you've commented on today. Thank you.
Kamal, do you want to ask really quickly?
Yeah, sure. I'll be real quick. Such a pleasure to hear from all of you guys, and you bring a wealth of knowledge from your individual unique perspectives up. Chang, you mentioned how you reached out to different offices using your White House credentials. What's the most graceful way to do that? I know that there's a need to coordinate with staff, and I know that can become chaotic, but there's a need to balance that with the need to go forth and do great things. So what is your advice on that?
I think the staff is going to be very helpful on that. First of all, I didn't even know who I needed to meet with. So the staff helps you to identify the right partners at the meetings. But I think the way to do that from my perspective was to ask the staff, I want to meet with someone on this topic. Who would those people be? And then can we make the request as the White House commissioner making the request? And that way, the request isn't coming from a staff member; it's actually coming from the White House, believe it or not. So that's actually how you get access.
Thanks.
Hope that answered you.
I think we have a break coming up. First, I want to say thank you to all of you for coming on and for just being so gracious with your time. I know we'll probably be asking you many questions, but and more to come. But it really, like, the insights you've given here are so important and poignant. And to my colleagues, this is going to be important as we deliberate sort of the subcommittees and sort of what we want to get done. And again, because this is a rolling basis, we can imagine we don't have to do all at one time, but we can take on a few things at a time and keep in mind, I think, the idea that we can take on more. So I really appreciate all of you coming on, and thank you for being so gracious and answering these questions also, because these are questions that we're all sort of trying to figure out how to get our hands around the scope of what we can do and should do. Well, for everyone here, we have about 10-minute breaks, 7-minute break. We're going to come back at 4:10. So thank you again for staying on, and I look forward to seeing Daphne, Tessie, Tung, and Chilling again soon.
Thank you.
Take care.
Bye-bye. Thank you.
Bye. Thank you.
Welcome back, everyone. Thank you for your continued attention to the work that we're doing here and to our, as we go into our next presentation. We now are going to shift the remainder of today's agenda by focusing on key priorities related to the immediate challenges that are impacting AA and NHPI communities. We had a little bit of this from our former commissioners. They gave us some insights. The first segment will focus on health and economic impacts of COVID-19. It continues, it is going to continue, and this is going to be important for our communities. As many of you know, the pandemic has significantly impacted AA and NHPI communities, and like all communities, but also has had a disproportionate negative impacts specific to AA and NHPI communities across the nation. These impacts are often related to physical and mental health, business-related concerns, and however, these disparities and impacts may not be as widely publicized or known to the general public. Our communities know about it, but the public itself doesn't always know about it. So today, we have the pleasure of having Dr. Cameron Webb, who is a senior policy advisor for equity at the White House COVID-19 response team. They have been doing yeoman's work, and I'm not sure they've had enough time to sleep in the last year. Dr. Webb is former assistant professor of medicine and public health at the University of Virginia School of Medicine. He has worked in the university's COVID unit since the beginning of the pandemic. Let's welcome Dr. Webb. He has he's going to share some key information with us on how COVID-19 has impacted AA and NHPI communities. I know he's on the phone because he wasn't unfortunately able to get on the camera, but we will get to listen to him. So Dr. Webb, we're really happy to have you here.
Thanks so much for having me. It's good to be with you. And actually, at some point in the next probably 2 or 3 minutes, I'll be able to get to a computer. So maybe you'll see my face shortly. But we'll go ahead and jump in because I think it's so important to talk about really the health consequences and impacts of this COVID-19 pandemic on AA and NHPI communities. And I think that, so often when we talk about COVID equity, I think people lose sight of exactly what that means, all the different domains and dimensions by which we're looking to ensure an equitable COVID-19 response. And by equitable, we mean that every community and every place has the opportunity to not just survive, but thrive through this pandemic, and that we're paying close attention to the disproportionate impacts that the pandemic is having on folks. And so really just pulled together some slides for you. And so as you can see from the deck there, it's described as COVID-19 equity, understanding and addressing pandemic dynamics in AA and NHPI communities. Next slide, please. And as we jump in, I think the first thing I want to do is just look at COVID-19 impact at a glance. And if you look at the slide here, this is from CDC, and you see something that's probably pretty familiar to many of you. You see that, on the bar graphs that you're seeing, first, you'll see that these really high rates, this is age-adjusted, lab-confirmed COVID-19 hospitalization by race and ethnicity. And so the first thing you'll see is that for American Indian, Alaska Native, the rates are really high. For non-Hispanic Black, really high. For Hispanic and Latino, really high. For non-Hispanic White, it's lower. And then lowest is for non-Hispanic Asian or Pacific Islanders. And so people would be led to conclude from this slide that group is doing pretty well, and we shouldn't devote our resources or attention to addressing those needs, but instead we've got these other problem areas. Next slide, please. And I think similarly, you can look at this next slide. This is from Kaiser Family Foundation, and so this is the percent of the total population that's received at least one vaccine dose. So, vaccines certainly aren't everything. There's a lot more to this pandemic than just vaccines. But we know that a lot of people are looking at that as our key way through this pandemic. And so we often look at and track the vaccine access and uptake as a way of knowing where we are and how we're doing. And similarly, you look at this slide and you see all the different communities that are depicted here. You see in terms of the vaccination rate among white adults and among Black adults, Hispanic adults. And there's one that's far and away above the rest, and that's Asian individuals. And it's at 83%. Everybody else is grouped around the mid 60%. So if you were asking yourself, well, where should we focus our energy and attention? Yet again, it's going to direct you to other groups rather than the Asian population. Next slide, please. And I think that what this does, and this is 1/3 slide, this is looking at the vaccination effort in children. And this actually broke down different communities. So you see Connecticut, DC, Michigan, Minnesota, North Carolina, South Carolina, and Vermont. And if you look, there's one bar that stands out above them all, and it's, again, in Asian children, much higher vaccination rates. This is, precisely the kind of challenges that I think we need to be thoughtfully navigating here, because experientially, we all know that this doesn't tell the full story of the pandemic in Asian American or NHPI communities. What it tells is a story of this aggregate perspective, and it reinforces the really troubling, really challenging model minority stereotype that's made it hard to mobilize resources to communities that have been truly, really hard hit by this pandemic. Next slide, please. And so, I think the first thing I like to depict, and of course, we're among friends here. I say this is choir practice, and so I understand I'm preaching to the choir, but even still, if you look at the Asian American, it's referring to many ethnicities, and I really like this this graphic from NPR, because it just shows here in the United States just how many different ethnicities are depicted when we talk about what we mean by Asian American. Next slide, please. So on the one hand, it's many ethnicities, but beyond being many ethnicities, it's also many languages. And this is a slide that just depicts the third most common language spoken. So there's English and Spanish, and then this is what's third. And you see so many different languages that are described here, which really in some ways kind of heralds the notion that there are a lot of different types of communities that are described, that are depicted. So you see Vietnamese, you see Tagalog, you see you see Chinese, you see lots of different, you see Korean in different parts. I'm here in Virginia. That's we have. So you see there's lots of difference, lots of variation there. Next slide, please. So many ethnicities, many languages, many experiences. And here we see, and I know we'll talk about this some more later, but on the x-axis, you see the percent of adults age 25 and above who have at least a bachelor's degree. And on the y-axis, you have median household income. And so to describe this as a monolith, to describe this as all one community would be folly. But not only that, we know these same factors, these same experiences drive COVID-19 outcomes. And that's what makes it the most challenging. We know that these are the very factors that increase the likelihood that somebody's a frontline employee, that increase the likelihood that someone has multiple chronic conditions. And so it's hard to describe this as a single entity, a single group that's all having shared or similar experiences. Instead, we know it's many experiences. Next slide, please. And so, here's the data that we pulled most recently from the CDC. So this is looking at weekly cases per 100,000 population by race and ethnicity. And this is from early December through just 2 weeks ago, which really I think is the most up-to-date data that we do have from CDC. It takes a little while for states, for localities, for tribes and territories to send in their data. But you see the differences here. And so we're looking at in terms of cases, the highest case rate we see among Hispanic individuals. We see next is Black individuals, and you see the Asian and PI group is right at that same level. After that, it's American Indian, Alaska Native, and then finally white non-Hispanic. So that's the current state. Next slide, please. And so that was cases. Next we'll look at emergency department visits, and this is one where we've seen, again, some similar trends. We see the Black non-Hispanic rate of emergency department visits was the highest, and it's come down a little bit in recent weeks. You see Asian Pacific Islander is next. It's currently the highest in terms of ED visits. And then you have Hispanic, and then you have the white non-Hispanic, right? Next slide, please. Hospitalizations is next. Really saw a tremendous spike in hospitalizations in the Black community, and that's certainly been cause for a lot of concern, but we're also seeing increases in hospitalizations across demographics. And so you see American Indian, Alaska Native, you see Hispanic, you see white non-Hispanic, then you see Asian Pacific Islander is lower down on that list. But again, don't want to be convinced that there aren't challenges there. And next slide, please. And then finally, if we look at deaths, you see a similar trend. Again, all the different demographics, but again, you see Asian Pacific Islander toward the bottom. And that tells a story. It tells a story of a difference. I'm getting logged on my computer, so you should be able to see me shortly. And I'm gonna switch gears. But I think here the takeaway is that you see all these differences, but that is when we have aggregated data of an Asian Pacific Islander, which can be challenging and problematic. I'm going to switch over audio devices, and I'm going to go to the next slide. Okay, so you should be able to hear me okay. That was hopefully seamless. But I think if you go beyond even CDC's data and you say, well, what do we actually know? There's been a tremendous amount of research that's come out over the course of the pandemic that tells the true story of the pandemic on Asian American and Native Hawaiian and Pacific Islander communities. Here's an article that spoke to some of those challenges. While you see the Asian Americans make up a small proportion of COVID deaths, there's higher so you see significantly higher excess all-cause mortality, 3.1 times higher. You have higher case fatality rates, and then the higher percentage of deaths attributable to COVID-19. So mounting evidence suggesting that disproportionately low testing rates, more disease severity at case presentation, different socioeconomic factors, as I just described, and then racial discrimination, these all contribute to these disparities. And that's significant. And again, it calls for something that'll become a theme. Improving data reporting and uniformly confronting racism are key components. Next slide, please. Similarly, here's another one that kind of speaks to disaggregating Asian race, reveals disparities among Asian American patients in New York City's public hospital system. This was a really important paper that just showed that, again, not a monolith, different experiences for different demographics. Next slide, please. And then, when we're looking at kind of specifically with no data, there's no equity. And I believe that to its core, talking about addressing the lack of data on COVID-19 for Asian American communities, you see similarly that health data were deficient before the pandemic, not sufficient research happening, but that is, it created this misconception that there's a low share of deaths and cases. And in reality, Asian Americans, as this study found, have higher COVID-19 case fatality rates than other racial and ethnic groups, and the second highest increase, 37% increase in excess mortality in 2020. That is dramatic, significant, and worthy of significant intervention. Next slide, please. And so this is where I look to some of the bright spots. And every other week, so every 2 weeks, we meet with all of the state and local, all the state and territorial COVID-19 equity leads. We asked every state to name kind of a person who would be their point person for equity. And the team in Hawaii has been just really a joy to work with. They even presented some of what they're doing to some of the colleagues across the country a few months back. This is how they look at the race of COVID-19 cases. And you see that they break it down a little bit differently. It's not just, Asian American, NHPI. It goes into Native Hawaiian, Pacific Islander, Filipino, Japanese, Chinese, other Asian. And I think it tells a more robust and complete story. This is looking specifically at cases overall. It tells a more complete story in terms of what's happening in this pandemic. Next slide. And so that's the story in terms of cases, but look at the story in terms of deaths. You see a very different picture when you're looking at white versus Native Hawaiian versus Pacific Islander versus Filipino, Japanese, Chinese, other Asian. You see different stories of different impacts of this pandemic on different communities. And I think that you'll see other data that'll tell you that there's excess deaths in the Pacific Islander population or among Native Hawaiians. But again, you're seeing it here playing in front of you because the data was seeking to disaggregate, to really understand what's happening, who these outcomes are affecting, and really telling a complete story. Next slide, please. And I think that's why we asked CDC, what more can we do? How can we look at this in different ways? Because they say all politics is local, but all equity work is local as well. And we looked at the counties with large non-Hispanic Asian populations and recent high burden of cases. So this was just through mid-January. And you see that in different parts of the country, you have very different impacts. There are 136 counties that had large non-Hispanic Asian populations relative to the national average, and 98.5% had high recent burden of COVID-19 cases. And so that's a significant impact that COVID's having in those communities that have large non-Hispanic Asian populations. Next slide, please. And similarly, when you look at counties with large non-Hispanic Pacific Islander populations in the recent high burden, similarly, 173 counties that kind of fit that bill. And when we say large, again, 0.2% or more is what they're describing. But even still, we're seeing 96% had
high recent burden of COVID-19 cases. This is just kind of a starting point or a next step in how do we really get more granular. And you can imagine how we can take data like these, overlay it with the different countries of origin or the different ethnicities that we are looking to understand what's happening. It tells a different story, and it helps us figure out what linguistically appropriate interventions look like, what culturally appropriate interventions look like, what community-based organizations or faith-based organizations or other entities, community health workers, we should be coordinating with to really meet and serve the needs of these communities. Next slide, please. And so, I think there are a couple of things that are as I say, the wind in our sails. The president announced very early on that equity would be at the center of this pandemic response and issued on his second day in office, January 21st of last year, an executive order on ensuring an equitable pandemic response and recovery. Next slide, please. And just to tell a little bit about that task force, it was charged with making recommendations on optimally allocating COVID resources, dispersing relief funds in a way that advances equity, ensuring effective culturally aligned messaging and outreach, and you can see how that's important in this context, addressing ongoing health inequities faced by COVID-19 survivors, collecting data for the hardest hit communities. Again, you can see how that's really critical, and then addressing longer term data shortfalls and challenges. And if the disaggregation of data isn't one of those, then we're missing the mail. Let's next slide, please. And so the task force was really bolstered by an additional executive order just 5 days later. It was a memorandum condemning and combating racism, xenophobia, and intolerance against Asian Americans and Pacific Islanders in the U.S. Next, if you could click, and actually if you pull out and click one more time, please, what it actually shows is the Secretary of Health and Human Services shall, in coordination with the Health Equity Task Force, consider issuing guidance describing best practices for advancing cultural competency, language access, and sensitivity towards Asian Americans and Pacific Islanders in the context of the federal government's COVID-19 response. So, really just important work there. I'm gonna fast forward just a little bit. So next slide, please. We have a couple of slides that I wanted to share, and next slide as well. And unfortunately, I do have to go shortly, but I want to go to this one slide, advancing cultural responsiveness and language access. These are the recommendations from the task force. So the final recommendations came out in November. And what it says is that not only are we advancing cultural responsiveness and language access for Asian Americans, Native Hawaiians, Pacific Islanders, and other populations facing pandemic-fueled discrimination and xenophobia, but next slide, please. You can see what it means is the federal government should advance cultural responsiveness to language access and increase awareness of different experiences that these communities and other populations facing xenophobia and discrimination are doing by doing the following. And you can just click through about 4 or 5 different times, but requiring federal agencies to make communication transparent, culturally and linguistically inclusive, allowing sufficient funding to agencies to review enforcement of anti-discrimination protections, implementing solutions, enforcing anti-discrimination protections, supporting education about Asian Americans, Native Hawaiians, Pacific Islanders, mobilizing action plans to quickly respond to discrimination and hate crimes, and you can click one more time. And then using an equity-centered approach to create future pandemic plans and combat disinformation. That's one of the final recommendations that's here. And I know I have to go, but if you can click one more time, I have kind of a series of other recommendations that aren't the final 55 recommendations, but that still inform the task force's work. And a lot of those have to do with data. Hopefully we can share these slides with the group afterwards. I have about probably eight or so different interim recommendations that were part of the task force's recommendations, and a lot of them have to do with data, and we're taking them very seriously. They focus in, and this is a good example, collecting and disaggregating data. So I think it's really, really important work. And if you can click all the way to the end, I think we can click forward probably 6 or 7 times, you'll see there's more interim recommendations, and there's going to be one final slide that I wanted to end with, this one right here. And it's New York enacting groundbreaking law to change how Asian American populations are counted. I think a lot of us are aware of this law. It's important because it's just more evidence that this can be done. It can be done. It should be done. It will be done. I work closely with the Equitable Data Working Group here in the White House. There's a lot of work that we need to do, and everybody understands how the disaggregation of data is part of that. Everything is impossible until it's done. But I think that this pandemic has shown us more than any time before how critical this is to the health and well-being of really a population that needs to be better appreciated and better supported through this tough time. So with that, I'll pass it back. Thanks so much for having me. I apologize I have to run, but thanks for having me today.
Dr. Webb, thank you so much for being here. And I'm sorry we won't be able to ever ask any questions, but to my fellow commissioners, this is one of the places where we can also ask for more information and have more interaction with Dr. Webb. But it's also a great example of why data disaggregation matters, and very specifically what the story told in the first slides to what we learned in the later slides when the data is disaggregated, why it matters for our communities. So with that, I'm going to go on to our next panelist to focus on economic data and national policy related to AA and NHPI communities. Please welcome Bharat Ramamurthy, who serves as the Deputy Director for the National Economic Council. He's previously served as a member of the Congressional Oversight Commission for the CARES Act and was the top economic advisor to Senator Elizabeth Warren's presidential campaign. Bharat, it's so nice to have you here, and thank you for taking the time.
Thanks so much for having me, and I'm really looking forward to this opportunity to share this information. I'm going to focus on the economic impacts of the COVID-19 pandemic and the subsequent economic recession on the AA and NHPI community. And I want to, before I get started, I want to thank Ryan and Teresa from my team for helping pull this material together in advance of today's conversation. And I also want to flag, as Dr. Webb did, that in many instances, the quality of the data and the disaggregation of the data is not at the level that it should be. You know, when we're trying to understand the impact of COVID-19 on the AA and NHPI community, many of the data sets that we traditionally rely on to look at small business performance or the labor market or childhood poverty and so on are not disaggregated at the level that we would want. And so throughout the slides and the presentation, you'll see notations at the bottom when the data is not as robust and disaggregated as we want, but I still think we can get a good overall picture of what's been happening over the last 18 months or so. So if you go to the next slide. Want to cover two basic things today. First, some information on the economic impact of COVID-19 over the last roughly 2 years in three categories: the labor market, small business, and poverty. And then want to finish up with some short recommendations for further action and further study. Next slide. So on the labor market, a few headline points before we get into some of the data detail. First, the data suggests that overall employment levels for the Asian American population have recovered quite strongly since the onset of the pandemic. That's the good news. The bad news is that, first of all, the percentage of Asian American folks who are unemployed, who are actually in the category of long-term unemployed, is higher than for any other group. So basically the punchline there is that if you are unemployed and Asian American, you are more likely to be a long-term unemployed, and there are some consequences to that. And second of all, since 2008, so if we zoom out a little bit, the employment level for Asian Americans has actually declined the most out of all racial ethnic groups. So next slide. Here's the data on employment levels since the pandemic began, as you'll see on the chart on the left here, which looks at employment to population ratio. That's essentially a very basic figure, what percentage of the working age population is currently employed. And what you will see there is, of course, for across racial ethnic groups, a very sharp drop around March of 2020. And a recovery across all ethnic groups, but the light blue line, which is the Asian American population, you see that the dip was slightly less severe than it was for other groups, and that it is the only group that has, as of sort of late last year, actually recovered back to the level it was at in February of 2020. The slide on the right, or sorry, the graph on the right, tells a similar story. It looks at the unemployment rate. And you can see a similar pattern there, which is a spike around March, though not as severe as for other ethnic and racial groups, and then a steady decline back roughly to the level it was in February of 2020. Next slide. Here is the data I mentioned at the beginning about long-term unemployment. The graph on the left shows that there was an increase in long-term unemployment in September. So again, if you sort of think about it, long-term unemployment is roughly speaking 6 months unemployed. A bunch of people were laid off in March of 2020. Come September, the number of long-term unemployed starts to rise as you hit that 6-month mark since the pandemic began. And it's sort of a plateau into the beginning part of last year. And there you see the dotted line, that's the enactment of the American Rescue Plan, which was the president's economic recovery legislation. And you see a rather steady and sharp decline in overall long-term unemployment since that point. And that's important because there's a lot of economic literature talking about the specific harms and the particular harms that come with being unemployed for a long period of time. Folks who become unemployed and are able to find a new job within a few weeks or a couple of months, the economic consequences in terms of their wages and so on is not as significant. Whereas folks who are long-term unemployed, there tends to be longer-term implications in the sense that they often have to accept jobs that are at lower wages going forward, and that has lifetime impact on their overall income. So we really want to avoid long-term unemployment to the extent that we can. And as you see on the right side of the screen here, if you look at the numbers by ethnicity, this is the percent of unemployed people who were unemployed for more than 15 weeks. You see that the Asian American population has the highest rate there. So overall, a good picture, but a specific problem on long-term unemployment. Next slide. Here's data looking all the way back to 2008. I thought this was interesting because while the recent story between 2020 and today is a strong one in terms of the Asian American population rebounding very quickly, again, in the labor market, what you see is that since 2008, the unemployment level among the Asian American population has actually fallen the most relative to other ethnic groups and racial groups. So there is a longer-term issue here that is somewhat at odds with the relative success in the last 2 years. Next slide. So that was the labor market. Now I want to talk quickly about small business. Obviously, this is an area where the Asian American population is highly involved. The data here shows a few things. Number one, Asian American small business owners are more likely to work in areas that have been hardest hit by the pandemic. Second of all, and probably related, Asian small business owners are experiencing fewer signs of recovery. And third, discrimination has played a role in exacerbating the challenges for Asian American small business owners. So we can dig into all of those in a bit more detail, starting with the next slide. So this shows the areas that are that have the highest percentage of Asian American owners. So food and accommodation services, you'll see that top line. About a quarter of small businesses in that sector are owned by Asian Americans. Retail trade, you see, is the second highest, about 16%. What the lines that are indicated in dark blue, those are areas that have been, that are sort of hardest hit by COVID-19. Again, not a surprise to think that food and accommodation services and the retail sector, and the one at the bottom there, education services, have been hardest hit by COVID-19. And as you can see, those are areas that tend to be where Asian American owners are overrepresented. Next slide. And again, as you would expect from that last slide, if you look at survey data, they went out and asked small business owners, do you agree or disagree that we have turned the corner on the pandemic and businesses returning to normal? And I should note that this is a little bit out of date, but the most recent evidence that we were able to find. And you can see that AAPI women and men are all sort of below the baseline level for their gender. With 50 plus AAPI women actually at the lowest of all survey groups. You see that at the bottom, only 26% agreed with that statement. So sort of the survey data tends to back up what we are seeing in other data sources about how the pandemic has been particularly hurtful for Asian American small business owners. Next slide. And I think we have to be clear that that hate and discrimination have exacerbated these challenges. This is data specifically from New York City-based Asian American small business owners. And the question that says, it found that 8 in 10 Asian Americans said that violence against them was increasing since the pandemic, and 1 out of 3 fear threats and physical attacks. A related data set, if you look on the right side here, is if you look at different neighborhoods in New York, where was the overall biggest drop in consumer spending in 2020 relative to 2019? And you see that Chinatown suffered the biggest drop, a significantly higher drop than New York City as a whole, again, reflecting, at least partially, some anti-Asian bias and concern about COVID. Next slide. Last category is poverty. One of the things that we in the administration, and I think the president is most proud of, is as part of the American Rescue Plan, introducing an expansion of what's called the child tax credit. That's an additional monthly payment that goes to parents of small children. And overall, it has had a remarkable effect at bringing down child poverty over the course of 2021. Some approximately a 30 or 40% reduction in child poverty, representing millions of children brought out of poverty that year. If you look at the data here on this slide broken out by race and ethnicity, at the bottom right-hand corner, where it says 212,000, that is the number of Asian American children that were moved out of poverty in 2021. That represents a roughly 30% reduction. So, in my mind, a remarkable achievement and something to be really proud of. Next slide. Oh, can we go to the next slide, please? Thanks. So I want to finish up with some recommendations based on all that data. First, going back to the labor market, there's a particular issue with longer-term unemployment. And as I noted, this administration has been very focused on reducing long-term unemployment overall because there is an enormous amount of data about what's called the scarring effect of long-term unemployment, what it means for folks on their long-term earnings potential, what it means for wages over their lifetime, what it means for, honestly, on the health side as well. Making sure that people who do lose their job find a new one very quickly, that's very, very important. And so the fact that the long-term unemployment level is elevated among the Asian American population, even as the overall employment level is quite strong, means that we need to keep focusing on what to do to help long-term the unemployed, which will end up having a particular benefit for the Asian American population. Second, we need to keep building on the work that we have done already in this administration on helping small businesses. And there are a lot of options right now for small business owners who need relief. The Small Business Administration is running a bunch of programs. The Treasury Department will be rolling out a program very shortly that will be about helping small businesses grow and build. We need to make sure that that is reaching every community. I think if you have talked to a lot of small business groups, which I have done over the last year or so, one consistent problem that you hear is that small business owners don't know how to access the relief that is available to them. The ones who are more sophisticated, the ones who have an accountant, the one who may already have a lawyer, they know about these federal programs, they know how to fill out the paperwork, they know who to talk to get, a big loan or a big grant. The person who is a sole proprietor, a person who may run a small nail salon, who might run a small, corner store, may not have that kind of access. And so one thing that we did included in the American Rescue Plan, this was a particular priority of the president's, was something called the Community Navigators Program. It provided funding to local community groups who would go out and dedicate people to helping small business owners access relief that's available to them. That is already starting to roll out, and we think it will be a big help because oftentimes there are maybe language barrier issues or other technical issues that stop people from getting relief, and we want everyone to get the relief that they're entitled to. Third, on the poverty front, as I noted, in the Asian American community, we're talking about a 30% reduction in child poverty. Unfortunately, that provision of the American Rescue Plan from last year has expired. And so it's been a priority of this administration to extend that credit so that we continue to see the benefits of that reduction in child poverty. And fourth, as I said up top, in a number of these areas, we kind of ran up against a barrier where the quality of the data limited us from making more granular analyses. And I think that we would want to push for more disaggregated data in all of these different data sets so we can better capture the experience of different parts of the AA and NHPI community. That's it. Thanks very much.
Thank you so much. I'm gonna start with asking you one question, but then I'm gonna open it up because I know everybody's got questions for you. So I want to give them a bit of time too, if you don't mind. I just want to sort of link to the last sort of couple of points that you made about AA and NHPI small businesses and federal programs. And I think in this case, just thinking about how, I know you have the Community Navigator program, but as that's rolling out, what are ways that this commission and others can help in making sure that information is getting out to AA and NHPI communities? And honestly, how do we help them apply it? Because sometimes, you know, I live in Texas and I could see the small businesses there don't always know how to even apply, even though when they know it's there, they don't know what to do.
Yeah, so I think that there's a few things. Number one, there's often a language barrier that comes into play for these communities. And we in the administration have been very focused on making sure that when the Small Business Administration put out a sheet that says, here's a handy guide for how to apply for program X, right? And they try to do their best to boil it down to a single page of directions that somebody can follow without having to go find an accountant and a lawyer. Well, that's not very helpful if it's not available in the language that somebody speaks, right? And for the Asian American community in particular, there may be dozens of languages that we need to translate that document into so that we can, so that people can take advantage of it. That's something that we're working on. We've made a real point of emphasis. Second, the goal of the Navigators program is to find people who are well known and involved in their communities, and so they know how to reach the harder to reach folks. I mean, one thing about policymaking is that you have to be humble about what you can do and what you can't do. And one thing that the federal government, I think, isn't as good at is having contacts and resources in these smaller communities in particular areas where the best thing we can do is empower and provide resources to a community group that's been operating in that community for a dozen years and who the people in that community trust. I mean, if you're filling out a document that you're submitting to the federal government and you see that on it that you are making representations on that document about your business under penalty of perjury and that there could be an audit, that's a scary thing. And you may be worried, if I don't understand this correctly and if I fill out this form wrong, am I gonna go to jail? Are there gonna be tax audits? And so getting people who you trust to explain to you how to fill out the form correctly, that's really important. It's also something that community organizations are going to be better suited to do than individuals in the federal government. So it's a really complicated problem. It's not something that, unfortunately, we can solve overnight, but it's something that we're really dedicated to trying to do.
Well, I have to say, I'm grateful that you are doing that because I think it's important. Whatever gets started gets carried on. So it's good to get it started and to keep moving that. And I'm just one quick follow on to that. I'm assuming that the community navigators are also linked into the regional networks that we met with earlier.
Exactly. Yeah. There's already an existing SBA regional network that's quite effective. We just thought that the community navigators were a way of sort of extending the tentacles a little bit more and getting into harder to reach communities. And that again, we are rolling out that program. We got funding for it last year, but we are making progress on that front.
Awesome. Thanks. Well, I see my colleagues have their hands raised, so I'm going to go ahead and start with all of them. Ajay, do you want to ask your question?
Thank you, Sonal. Thank you, Bharat. My name is Ajay. I'm from California. This was very insightful. In addition to all the challenges being faced by what you have listed out by the small businesses, there are a lot of opportunities in the federal, contracts and grants and things. But as a small business owner, as you pointed out, they do not understand how to go and apply for become a federal contractor or have a small business, supply to the federal needs. Or those. What efforts has been done to demystify this whole process and go in the communities around the country and tell them this is how you apply, this is how you apply for the grant, this is how you apply for the federal contracts, or this is how effectively have you used the South Asian media to reach these communities?
Yeah, great questions. I think one of the things that we are focused on is each agency has a goal about what percentage of its contract dollars should go to small businesses. And one of the concrete things that we can do is increase that goal. And then make it incumbent on the agency that, and these are hypothetical, but if you go from 15% of your contracting dollars have to go to businesses with fewer than 50 employees and raise that to 20%, that's going to put the onus on the agency to figure out how to make sure you are making things easier for small businesses to apply. And so again, that is something we've been working on. The president has also issued an executive order on promoting competition throughout the American economy, which means in part helping small businesses compete on a more level playing field. One of the key ways that we can do that, and one of the directives that he had to every agency in the federal government, was that in your procurement decisions, figure out ways of making it easier for small businesses to participate and take advantage of federal contracting opportunities. So there's each agency has a different approach, but it is something that we're working hard at.
Thank you.
Renal, do you want to
go? Yeah, my name is Reno Samoa. Thank you so much for presenting. Comment and a question. It's a little disappointing that Dr. Webb couldn't stay on, mostly because of the disproportionate impact COVID's had on Pacific Island communities. And, the drivers of that being mostly socioeconomic conditions like income level and education. So I'm hoping that in the future we can partner with them, because I didn't see in his presentation any of those root data disaggregation efforts. Everything was on downstream methods like cases and socioeconomic resources surrounding that. And those drivers are notoriously not disaggregated in Pacific Island communities. And they're going to continue to drive the pandemic for NHPI people. The second thing was, so the presentation I saw, there was a couple of notes that said NHPI not included. And most of this, I believe, was Asian American businesses. In fact, thank you for including the language that specifically just said Asian American. And a lot of business owners, Native Hawaiian Pacific Islander business owners, don't identify as Asian. So they don't know that a lot of the RFAs and initiatives are out there pertain to them. Second, what are you doing? Because it is an OMB mandate that this data is disaggregated. What are you doing to help rectify that? And what can we do as a commission to help support those efforts?
Yeah, look, I also was frustrated in trying to look through this data to find that it was not disaggregated at that level, and it was important to us and to the team that we note everywhere where that was the case, so that we weren't painting an inaccurate picture. As you said, there is a mandate or an encouragement to make progress on that front. I think that actually going through this process of preparing this presentation, for me at least, has revealed additional areas where we could use additional disaggregated data. Some of those data sources are things that we in the government directly control, right? They are government data sources, and it would be easier for us to push in that direction. And we, at least I will plan on pushing that we do so. Some of these data sources are private sector data sources. That's obviously a little bit harder. But I think one thing that you as a commission can do, and that would be helpful to have, is an encouragement for these private companies that do lots of data collection that we in the government rely on, a lot of policymakers rely on, ask them to also take the steps necessary to try and disaggregate the data.
Thank you. Victoria?
Yeah, thank you, Bharat, for just the data and the information. And, with just COVID and, this past few phases of the PPP loans, and we saw a huge gap, right, in Region 4, and I'm sure many other regions across the United States, of the small businesses, especially the LEP, limited English proficient businesses, gaining access to the resources and kind of coming on the tail end of, being able to access or be connected to like the SBA loans or the SBA representatives or the small business development centers or some of the other local resources. And I know we've been, advocating for a long time to make sure that funding is available for local partners, right? Trusted leaders in the community. And I'm so excited to hear about the Navigator program. But I also kind of echo where Mr. Carey in chat mentioned that there are a lot of these compliance and these federal grant mandates that kind of also prevent local nonprofits or trusted leaders like, folks on the ground from accessing even those programs, right? And so I guess my question is, what are we doing to kind of ensure that more funding come through these federal agencies, whether it be like the EEOC, the SBA, or other agencies that kind of help with some of the discriminatory and discrimination work or support for some of the communities, as well as the small business development support. And then also kind of flagging the recommendation that we just don't have enough funding for nonprofits and local leaders to do this work, and often kind of trailing a lot of the other communities just simply because there's just not enough resources for language access and direct consultation and support work.
Yeah, there's a lot there I want to touch on. I know we only have a few minutes, but I guess just a couple of quick points. One, when we look back at the data from 2020 on all of the distribution of small business relief, it was clear that that money was going to larger small businesses. It was going to more well-connected small businesses. It tended not to go to small businesses that were located in lower income and minority communities. And so when we came in, it was particularly important for us to try to make policy changes that address that. Now, part of the problem is that Congress writes the rules for the PPP, and we in the administration are required to follow those rules. But with the discretion that we had, we took a number of steps to try to better target the money. And one of the things that we did, for example, was announce a period of time when only companies with fewer than 20 employees could apply. The PPP, for example, is available to small businesses with up to 500 employees. But the president felt strongly that those truly small businesses with fewer than 20 employees, it may take them a little bit more time to put their applications together. We want to make sure that they are getting support. So they got this exclusivity period. And if you look back at the data overall, in 2021, under President Biden, the distribution of small business relief was much more targeted towards smaller businesses and towards businesses located in lower income minority communities. And so we're happy about that. It's not to say that we've solved every problem, but I think we are happy about that. I think one design thing that the government should keep in mind, I think, going forward, is that a lot of these relief programs are first come, first served. So they say, here's a pot of $20 billion. Everybody who's eligible applies, and then we'll fund people until we run out of money. And having those kinds of first come, first serve relief programs necessarily helps those companies that are better connected, bigger, have more resources available to them already. And so I think we've learned not to set up programs that way, right? Or at least to have programs that say, a certain percentage of that relief money is going to be set aside and is only available to companies with fewer than 10 employees, or for companies that are located in lower income minority communities. So we're still learning a lot about how to better tailor and design these programs, and I think we have made progress.
All right. Unfortunately, I'm going to, Chang and Mia, I'm going to have to cut here because we've got a very long session coming, but we would love to re-engage with you as we start getting into our work and hopefully pushing for more of the data disaggregation that I know you're looking to do. But thank you for taking so much time. I know y'all are busy there, so really appreciate your making the time and look forward to digging into more of this data with you also. Thank you so much.
Thanks very much.
Chang and Mia, sorry, we'll keep a running list, and we can also bring people back in. So with that, I am going to turn it over to my friend, Erica Moritsugu, who is going to master lead this next session. I hope everyone has some water and ready to go, because it's going to be a great group that's going to be speaking next. I don't know about, I can't hear you.
Erica, we can't hear you.
My apologies. I was just going to say, Sonal, well-deserved break. I'm going to be your relief pitcher here. And I know that we're going to keep you plenty busy with the commission, and you're not looking for a new job, but if you ever wanted to be a news anchor or a marathon runner, I will be your reference. This has been an amazing run and a well-deserved break while I manage this conversation, which is exciting and sad and dark, and some of the hard work that we've got. But good morning, good afternoon, good evening. We actually have somebody calling in from Europe. So we're joined from across the nation and the globe, including our commissioners. I have the honor of introducing our next panel, which is focused on our key priority of addressing xenophobia, racism, and hate in the Asian American and Native Hawaiian Pacific Islander communities. You know, we've heard a lot of references throughout the day about the recent years, alongside with the COVID-19 pandemic, the uptick in anti-Asian hate and violence, which has surged. So our panelists today are going to share information and thoughts about the disturbing data we've seen and what the federal government and this administration and y'all as commissioners and community leaders and community members can do to address this issue. I'm going to shift a little bit in terms of the speaking order and introduce Rachel Rossi, Deputy Associate Attorney General at the United States Department of Justice. She was recently appointed to the Department of Justice as the Hate Crimes Coordinator. And in these roles, Ms. Rossi leads efforts related to criminal justice reform, community law enforcement engagement, access to justice, and combating hate crimes and bias incidents. Rachel, thank you so much for joining, and the floor is yours.
Thank you so much, Erica, and thank you for your leadership. Good afternoon, everyone. Thanks for having me here today. First, I just want to bring some warm greetings from Associate Attorney General Vanita Gupta. She regrets she's unable to attend this event today, but as I'm sure you know, Vanita Gupta is dedicated to combating hate and is leading a lot of this work at the Justice Department. She specifically sends her gratitude and congratulations to the newly launched President's Advisory Commission on Asian Americans, Native Hawaiians, and Pacific Islanders, to all of you, the presidentially appointed commissioners, to the co-chairs, Secretary Becerra and U.S. Trade Representative Ambassador Catherine Tai, and to all of the esteemed panelists and speakers who are participating in this inaugural meeting. So today I'm pleased to provide you with updates on the work of the Justice Department in combating hate crimes and incidents, xenophobia, and bias. First, I'd like to start to talk a little bit about some of the data that Erica previewed on the increase in hate. The FBI's 2020 hate crime statistics, which were released last summer, confirm what we saw, what folks have been talking about, what we've heard from communities, advocates, law enforcement agencies. Hate crimes rose in 2020 to the highest levels in more than a decade. And the majority, over 60%, were motivated by race and ethnicity. And of those, more than a third targeted African Americans. We also saw a troubling, sharp rise in reported attacks on people of Asian descent this year, including multiple terrible attacks on elderly people and women. Specifically, the data showed that anti-Asian hate increased by over 70%. This represents the highest total in more than a decade. And this sobering data still, sadly, does not fully reflect the full scope of hate that is being experienced by AA and NHPI communities across our country. Accurate data to track the full scope and the impact of hate is sorely lacking. The Justice Department unequivocally condemns hate and bias against AA and NHPI communities. We have mounted a comprehensive effort enhancing the deployment of all tools at our disposal to combat these two core problems, this rise in hate and the lack of fulsome data about the true expansive impact of hate. Attorney General Garland's first directive to the department upon assuming his role was to launch a 30-day expedited internal review to determine how the department could deploy all of the tools at its disposal to counter the recent rise in hate crimes and hate incidents. Informed by that review, on May 27th of last year, Attorney General Garland issued a comprehensive memorandum on improving the department's efforts to combat hate crimes and hate incidents. And as you know, that same month, President Biden signed the COVID-19 Hate Crimes Act and the Jabara Hire No Hate Act, which provided the department a new range of tools to combat hate crimes and incidents. In that memo, the Attorney General also designated me to serve as the department-wide hate crimes coordinator to create and centralize the department's anti-hate crime and incident resources and work to facilitate visibility and collaboration across the department's work in combating hate, and to ensure that this work is culturally and linguistically accessible, effective, and impactful. So today I'll just highlight a few areas of this work across the department. First, the Civil Rights Division continues to prioritize both the criminal and civil enforcement of hate crimes, violence, and discrimination. Since January of 2021, the department has charged more than 25 defendants with federal hate crimes. In addition, more than 20 defendants have been convicted. And the Civil Rights Division civilly can enforce federal statutes that prohibit discrimination on the basis of race, color, sex, which includes pregnancy, sexual orientation, and gender identity, disability, religion, familial status, national origin, and citizenship status. On the investigative side, the FBI has now elevated hate crimes and criminal official misconduct violations to its highest level national threat priority. This is increasing the resources for hate crimes prevention and investigations and making hate crimes a priority and focus for all 56 of the Bureau's field offices. So these enforcement and investigative efforts are critical, but we recognize at the department that tackling the complex problem of bias, hate, and xenophobia really requires much more than enforcement alone. The Justice Department is working to strategically expand and revitalize CRS, the Community Relations Service, who has regional offices across the country. CRS stands ready to work with communities that are harmed by hate incidents and hate crimes and responds to community conflicts arising from differences in race, color, national origin, gender identity, sexual orientation, religion, or disability. And CRS does not have investigative or prosecutorial authority. Rather, CRS impartially works with communities in conflict to help rebuild relationships, to facilitate mutual understanding, and to encourage and develop local solutions with state and local officials, community-based organizations, civil rights advocates, faith-based groups, and law enforcement. CRS also recently published a toolkit on preventing and responding to bias and hate incidents against Asian American, Native Hawaiian, and Pacific Islander communities. This toolkit is aimed at empowering communities to create and lead locally based anti-hate strategies. In addition, the department's hate crime enforcement and prevention grant programs also provide significant resources to support state and local partners in this work. In October, the Office of Justice Programs announced a total of $21 million in grant funding through these programs to state and local partners to investigate and prosecute hate crimes and to assist hate crime victims. And we're very hopeful that more grant funding is on the horizon as we wait for appropriation of the grant programs under the COVID-19 Hate Crimes Act and Jabara Hire No Hate Act. This funding will be critical to address one of the most significant barriers to fully tracking and understanding the impact of hate in our communities, the lack of accurate data on hate crimes and incidents. I was pleased to see that one of the express mandates for your commission is the prevention, reporting, response, and tracking of hate, anti-Asian hate crimes and hate incidents. And I believe this is an area where collaboration and partnership is really critical. We saw with the FBI's hate crime data for 2020 that for the third year in a row, the number of police agencies participating in the reporting program declined, with thousands of departments either not reporting any data to the FBI or reporting zero hate crimes. Over 12,000 law enforcement agencies affirmatively reported zero hate crimes, including 65 agencies in cities with populations over 100,000 people. We also know that trust gaps, language barriers, and other impediments create obstacles for victims to report hate crimes to law enforcement. More than 40% of all victims from 2015 through 2017 reported that they did not feel that it was productive or safe to report hate crimes to law enforcement. We also face the significant obstacle that the vast majority of bias and hate incidents may not rise to the level of a prosecutable hate crime. And we know that there are a host of inherent barriers to federal prosecutions of hate crimes, including gaps in the federal hate crime laws. So this lack of accurate data inhibits the ability of law enforcement to address and prevent hate crimes and to target the resources they have to fight hate crime. It also limits the ability for community-based intervention efforts to proactively ensure that resources and support are effectively targeted to prevent hate crime and violence. Accurate data is also critical simply in its power to acknowledge the collective trauma of impacted communities by just naming and identifying hate. Hate carries a unique impact when it is not recognized, not acknowledged, not addressed. It can leave victims and communities feeling unseen or insignificant, and that can even further exacerbate harm. So we were pleased to see that the passage of this new law and the new grant programs in Jabara Hire will tackle these problems head on. The law will prioritize grants for underreporting large law enforcement agencies, especially those who have not reported any hate crime in the last 3 years. And it will provide grants to support states and local government transition to the National Incident-Based Reporting System, or NIBRS, which is a more sophisticated and detailed crime reporting system that increases real-time reporting and transparency. To encourage victim reporting, the hate crime legislation allows for new grants to states to create state-run hate crime reporting hotlines. And it will provide for grants to assist states in conducting law enforcement activities or crime reduction programs to address hate crimes. In addition to these grants, the Act also includes a number of authorities for the department to issue guidance that will support state and local partners in the fight against hate. One of these guidances requires the Department of Justice to partner with the Department of Health and Human Services to develop guidance aimed at raising awareness in the increase in hate during the COVID-19 pandemic. This guidance is particularly critical given the resurgence of COVID-19, Omicron, and the continued increased acts of hate against the Asian American community in recent months. Last fall, Attorney General Garland and HHS Secretary Becerra convened a virtual listening session moderated by Associate Attorney General Vanita Gupta to start to guide the crafting of this guidance and what it would look like. 10 speakers from prominent anti-hate and community-based organizations, including 2 of the distinguished co-panelists on this panel here today, were present at that session, provided statements, observations, and data on the increase in hate during the pandemic and the types of guidance that would be useful. Over the past few months, together with our partners at HHS, we have conducted additional stakeholder engagement and outreach. We have collaborated with the COVID-19 Health Equity Task Force, and specifically with the subcommittee focused on combating xenophobia. So we will look forward to soon amplifying all of this feedback by issuing this guidance in coming months. So in conclusion, it is a top priority of the Justice Department to combat the scourge of hate, particularly the troubling rise in hate against AA and NHPI communities. And today I've only highlighted just a few of the many initiatives underway at the Justice Department. I know that one of the expressed goals for your commission is the pursuit of policies to end anti-Asian bias, xenophobia, racism, and nativism. And we look forward to working with you, supporting you, and joining you alongside you in this fight to eradicate hate. Thank you.
Deputy Associate Attorney General Rossi, thank you very much for being here with us and for us, and for leading DOJ's work around hate crimes and hate incidents. It's now my honor to turn to our next panelist, a friend and colleague, Chang, who's Deputy Assistant to the President and Deputy Director of the Domestic Policy Council. Mr. Baines previously served as the Council's Special Assistant to the President for Criminal Justice and Gun Policy. And today he's going to share a little bit about what the Domestic Policy Council is doing to address this issue. My friend, I turn it over to you.
Thank you, Erica. I appreciate your partnership in this work. I'm deeply honored to be here. Thank you to the co-chair, Secretary Becerra and Ambassador Tai. I appreciate the work of all that the commissioners are going to be putting in and their participation here. This is a particularly exciting moment. Today's inaugural commission meeting is a point of pride for President Biden. It brings to life his vision, which he set out in the executive order that he signed in May, that AA and NHPI leaders in this commission that a reinvigorated White House initiative on AA and NHPIs are critical to the role of the federal government in addressing just a host of issues, and leveraging the power of the federal government across the interagency to combat xenophobia, racism, and hate against our communities. So I could not be more excited to be with you. It's also a sobering moment. Rachel cited the staggering 70% increase in hate crimes against AA and NHPI individuals. The statistics, she also noted that they're not complete. We have a real challenge on our hands, and other sources suggest the numbers are even higher. We are facing serious headwinds. And statistics alone, even ones as stark as this one, the 70% figure, don't capture the devastating impact that anti-Asian hate has had on our communities. We've lost grandparents, fathers, mothers, sisters to violence. Our children and our elders have been afraid to go to school, to take public transit, or to leave their homes. Asian American businesses have been vandalized, boycotted, and forced to close. And throughout 2019 and 2020, many members of AA and NHPI communities have expressed that their pleas for help were ignored and their demands for justice went unanswered. This administration did hear those demands, and we are working to answer them. It's why the president signed into law the COVID-19 Hate Crimes Act. It's why he signed an executive order to drive an ambitious whole-of-government response to the rise in acts of anti-Asian bias and violence. In addition to requiring a central liaison to prioritize responding to this violence at DOJ, which gave rise to Deputy Associate Attorney General Rachel Rossi and her work, the EO also increased the resources and training for state and local law enforcement to accurately identify and report hate crimes to the FBI for investigation and prosecution. You heard several details about that. That's ongoing work and will continue to be a priority for this administration. Ensuring safety for AA and NHPI communities requires federal measures that are focused on prevention, intervention, response, and recovery. And the agencies are taking that mandate seriously. The Departments of Homeland Security, Justice, and Education are taking a coordinated response to the violence and threats against these communities. Starting with prevention, DHS actively evaluates reports of physical threats and incidents of violence against AA and NHPI community members so that it can determine trends and forecast potential threats facing the community in the near future. This allows DHS to prevent violence in cooperation with these communities before it occurs. Now, using that information, DHS has connected AA and NHPI communities with its network of local and regional partners across the country to assist with community-based violence prevention efforts. That work has included deploying volunteers to at-risk communities to deter attacks, and also training community leaders on the resources that are available to victims. DHS has also awarded security grants to 17 organizations serving AA and NHPIs so that local leaders can train neighborhood residents on how to establish community patrols or understand their rights in seeking assistance from law enforcement and community organizations. Now, the threats and the violence that we've been discussing here today weren't just directed at adults and elders, but also to AA and NHPI children. Now, schools are supposed to be environments that foster friendship, curiosity, and growth. Yet during the pandemic, schools became places in which AA and NHPI individuals, children, were harassed, bullied, threatened, and harmed. This has been a problem that we have seen throughout the country, and the Department of Education is responding. It has responded by training schools and educators on their legal duties to prevent and intervene when harassment and violence are directed at students and families. The agency also is working to empower students and their families to demand justice by sharing information online on how to file a discrimination complaint with the Office of Civil Rights. And they're making that information available in 11 different languages. We know that our community is a diverse one. It's got a multitude of languages. Language access is a real barrier to government services, and it's one that we are trying to stay focused on as we dismantle barriers to accessing resources. Now, beyond physical threats and violence, xenophobia, and racism and hate incidents imperil the stability of our communities. Rachel touched on this as well, right? It's not just acts of violence, it's also the everyday racism and hate incidents that we are seeing. Many AA and NHPI small businesses were the subjects of boycotts, vandalism, and robberies, and have been in recent months and years. All of that compounded the financial strain that entrepreneurs and employees experienced and continue to experience during the pandemic. President Biden's American Rescue Plan delivered historic funding of over $36 billion to keep AA and NHPI restaurants and bars open, among other restaurant owners. Other AA and NHPI business owners were able to access over $179 billion in capital from the Small Business Administration during the pandemic. These are some of the resources the president has tried to make available, and they were crucial lifelines for many individuals in our community. For AA and NHPI families that struggled financially due to job loss and the health impacts of the pandemic, President Biden has been working to ensure that the American Rescue Plan, as it's implemented, increases nutrition, emergency rental assistance, unemployment benefits, and subsistence benefits. All of these have been estimated together to reduce poverty in AA and NHPI communities over the past year by 22%. Now, we know that delivering justice requires more than responding to the immediate recovery needs of AA and NHPIs. It demands more than responding to incidents of hate and violence as they occur on a case-by-case basis. One area that we have prioritized is working to disaggregate federal data collection by race. That has been a key request of AA and NHPI communities because that information raises the visibility of the impacts of policy decisions on AA and NHPIs. With better data, we can ensure that we're developing better policy that meets the needs of our communities. Another area is research. An example of our investment in research is the work of the National Science Foundation. It's currently funding 100 grant programs across the country that are helping a wide array of researchers advance innovative studies to reveal new and more effective strategies for reducing the frequency and severity of discrimination and violence by underrepresented and underserved groups. That includes AA and NHPI communities. Delivering safety and justice for AA and NHPI communities demands that we do more, that we break down barriers of language access, that we create opportunities so that our communities can thrive across the country. This is why we're driving a domestic policy agenda that centers equity. It's why I am very proud to be in the role I'm in, serving at the Domestic Policy Council, to center equity for the entire government. And as the Commission embarks upon its work, we in the White House welcome your recommendations on ways to continue to protect, empower, and uplift our AA and NHPI communities. I'm looking forward to being a partner to you and looking forward to the work ahead. Thank you.
Thank you, Mr. Baines. We're glad that you're here with us too. And thanks for your leadership at the Domestic Policy Council and for raising the attention of this issue that's been so heavily impactful on our AA and NHPI communities. We're going to now shift to hearing more about this issue from the White House Gender Policy Council. Our next speaker is Shilpa Sadki, who is the Deputy Director of the White House Gender Policy Council and Special Assistant to the President for Gender Policy. Ms. Sadki was previously the Vice President for the Women's Initiative at the Center for American Progress, where she oversaw policy development and analysis, as well as advocacy and outreach on a wide range of women's issues. it's my pleasure to turn the hot mic over to Shilpa. Thank you.
Thanks, Erica. And it's such a joy to be here with all of you today. There are so many amazing leaders among you, and it's a thrill personally to get to see everyone, and really just want to say congratulations. Also pleased to see so many gender justice warriors among you, and so really looking forward to the conversation. I wanted to start really by just talking about the intersection of race and gender. As we talk about hate and we see in hate incidents, we really see those overlapping forms of hate and misogyny and sexism and racism. And I think it's really important for us to just take a moment to talk about those intersections, to acknowledge, that women and AA and NHPI women are often viewed as easy targets. That there is verbal harassment in addition to sexual harassment and assault. And when we add layers on layers of intersections around disability and immigrant status, a lot of this conversation is really about power and who has it and how it can be wielded against us. And so as we get in, I really want to talk about these intersections, but I also wanted to take the opportunity to introduce you all to the work of the Gender Policy Council and what we're trying to do together, and really have an open conversation and relationship as we go through the administration, and that that we're here as a resource and partner. If we can take the first slide. So just a level set, AA and NHPI women, almost 13 million and growing, right? This is a population that is increasing. And before we get into issues around gender-based violence and assault and harassment, really just want to level set, right? There's issues of employment and income and access to healthcare that are really important for us to talk about in the intersections there. Issues like occupational segregation. We know that some subpopulations are heavily concentrated in high-wage and professional management occupations, but others are heavily concentrated at the bottom in low-wage and service occupations. We often talk about the wage gap, and while many AAPI women in particular are looked at as making more, than Black women or Latinas, the details, when you disaggregate the numbers, are pretty stark. There's over 1 million API women in the labor force that work in jobs below $15 an hour. And where you may see Indian women working full-time having average high earnings, if you look at, say, Vietnamese women, it's much lower. And so I think it gets to a point in the conversation that Shrag mentioned, and I know Bharat did earlier, just about this disaggregated data and the importance of being able to highlight community-specific interventions. I would also be remiss if I didn't mention healthcare and access to healthcare and how that intersects with income and access to services. As we think about Medicaid, for example, and if we look at some subpopulations, over half of Bhutanese and Burmese women rely on Medicaid. I just wanted to level set for a second. Next slide. And as we talk about the topic for today in terms of combating hate and tolerance, I really wanted to point out the fact that in the United States, our families are facing heightened risk of gendered hate crimes, higher risk of domestic violence and sexual assault and trafficking, especially for folks with disabilities. Stop API Hate, recorded over 10,000 reports just in a very short period. And that women and girls report those sometimes twice as often as men. And if we're thinking about a gender inclusive lens and non-binary folks, there's even, increased heightened incidences there as well. Next slide. So taking a step back, last March, almost a year ago, President Biden created the Gender Policy Council by Executive Order 1420. And part of that executive order called for the first ever United States strategy on gender, which was published in the fall. And as part of writing the strategy, there was a robust consultation process. We met with 250 leaders from Congress, advocacy groups, academics, that included leaders from Hawaii. And remember, Erica joined us with some incredible women leaders in the Hawaii Commission. We met with over 270 young women and youth leaders, and that was an even specific girls session that we did with AA and NHPI young women. And we met with every White House component and almost every executive agency. And so the end of that process was a really long and robust strategy document, which I'm happy to share a link to. Next slide. And why does it matter? I know we often talk about strategies and reports, and I think it's important to talk about the significance of the strategy. First, it was the first ever United States strategy, really demonstrating our leadership on gender equity and joining only a handful of other nations in having such a document. It represented a whole of government effort. It's not just the work of this small and mighty team at the Gender Policy Council or our colleagues at the NEC or the DPC. It really requires the leadership of every department and agency across government, including Secretary Becerra and Ambassador Tai, whose teams have been really phenomenal. And the last piece is that the work of our council and of the strategy is domestic and global, to really unite our efforts to close gender gaps at home and abroad. As we know, many of these issues cross borders, and we thought it was really important to connect those dots. Next slide. A quick viewpoint of the strategy: there was guiding principles, strategic priorities, and implementation. Next slide. The guiding principles really spoke to three things: a whole of government approach, an intersectional approach, so crossing race and gender and every possible intersection you could think of, and then interconnected priorities, so that if we're talking about economic security, we're also talking about violence. We're talking about access to STEM and education. We're also talking about workforce. And to really highlight that those priorities are connected to each other and that work is really connected. Next slide. And this is just to share with you the 10 strategic priorities, of which I think the Commission will have a lot of overlapping work, from improving economic security and gender-based violence to equity and fairness and justice and immigration systems, advancing human rights, humanitarian relief, closing gender gaps in science, technology, and engineering and math, and work on democracy and representation and leadership. Next slide. And we are in the process now of implementing this strategy, which is why this is relevant to today's conversation. We are working really closely with every agency and government. We are integrating with broader equity efforts that Chirag leads on racial equity and diversity, equity, and inclusion. And we're really being thoughtful about the methods. We're working very closely with our colleagues at OMB on planning and budgeting, on policy and program development, on measurement, data, and on management and training. Next slide. And so how that sort of shows up here in this work is that agencies are required to demonstrate how they're going to be implementing the strategy. So work, for example, on gender-based violence is front and center. There is also work at the Gender Policy Council right now to reauthorize the Violence Against Women Act, which you know is a landmark and cornerstone bill, a priority of President Biden's, that has really important pieces to it in terms of culturally specific services, really connecting the dots between the work of OVW at the Department of Justice and work at HHS in family violence prevention. It highlights work that's happening right now through the American Rescue Plan. You know, there was almost $500 million in supplemental funding for violence against women in that bill. And part of that was $50 million just for culturally specific community-based organizations to improve access to services and safety. And then finally, we are in the process of working on a national action plan to end gender-based violence, which will truly look at some of these intersectional dynamics that my colleagues talked about, right? How do we get at gender-based violence at the intersection of these other forms of discrimination? What does that work look like? And really getting a lot of agency buy-in on attacking this. And I think that is very much the work that my colleagues spoke of before, the work that's happening at the Department of Justice, at the agencies around the government, but even more importantly, like breaking down these silos, where sometimes women's issues are in one part of an agency, but the real work on hate crimes is somewhere else. And so, I think that's really part of what we're trying to do, is to bring folks together and to acknowledge, these high levels and numbers of hate incidences and how that affects communities, how it affects how we operate together in society, how it affects the way girls think about themselves in the world. So we're really just excited to share more. Our one-year anniversary is coming up soon this March. And as we get going, really just want to offer partnership as we work together to tackle these really hard and complex issues. So that's it for me. Look forward to the discussion.
Thank you so much, Shilpa. Thank you for providing the additional lens of gender into the discussion. Understanding the intersectionality of race, ethnicity, gender, age, ability, and other identities is crucial to truly understanding the threats and the realities that so many people face, but also the barriers and the potential solutions to the issue. Our next speaker is going to provide the perspective on this issue from a community focus and share his recommendations. John Yang is the President and Executive Director of Asian Americans Advancing Justice, AAJC. Mr. Yang served in the Obama administration as Senior Advisor for Trade and Strategic Initiatives at the U.S. Department of Commerce, and you may have seen him on TV talking about these very issues these past couple of years. Please welcome Mr. Yang.
Great. Thank you so much, Erica. And I really appreciate this opportunity to talk to all of you. There are many friends actually in the audience. I know many of you from different guises, and that's wonderful. For those of you that are newer to the commission or newer to government service, one of the things I would want to emphasize to you all actually is you have a great partner in Erica and Chirag and Vanita and many other people here in the administration. And I want you to use this opportunity and use them to really advance the goals of our community and really find ways to develop that intersectionality between the different agencies and our communities, because you have a special opportunity here. And I want you to feel that energy. I want you to feel that, dare I say, power, and to use it for the good. Certainly as someone that is part of the community, that runs a nonprofit, that tries to advocate for all of these things, we need your help. And I look forward to working with all of you on all of these things. With respect to anti-Asian hate, frankly, you all know a lot of this stuff. And so I'm going to go through some of my slides very quickly. Rather, where I really want to focus some time is on some of these nuances, some of the issues that are a little bit below the surface that I want to make sure we talk about within our community, but then also bring it out with, outside of our community, so to speak. So if we could go to the next slide, one place to start is just to talk about the impact of hate. Right. We're here talking about the impact of anti-Asian hate. And well, we should. As an Asian American community, well, we should. But let's also remember that this hate is affecting so many other different communities. The Gender Policy Council obviously talked about it in the context of women. Absolutely true. And the intersection of women and the Asian American community. But let's not forget that during this period, we have also seen escalated violence against the Muslim community, escalated violence against the Jewish community, escalated violence against the LGBTQ community, and of course, the African American community. And so we have to also think about this hate and what we're experiencing in the context of all of that as well, because we will develop a stronger response together. And if we think about our work and then how that intersects with the similar commissions in the different other communities, I think then we develop a much more powerful response to all of that. Next slide, please. Second aspect that I want to make sure, and Rachel touched upon this, that we understand is the difference between a hate crime and a hate incident. And I think Manju will probably talk a little bit more about the wonderful reporting that she's been doing and what that looks like in terms of crime versus incident. Because the reality is that most of what we are seeing would not qualify as a hate crime. Crime literally involves a criminal statute, whether it's an assault, whether it's battery, obviously in the worst case scenarios, murder. But by saying that there's a distinction between hate crime and hate incidents, there's two things that are important. One is, within our community, we need to be careful about over-criminalization what that effect has on already marginalized communities and what sort of that law enforcement, what that effect might be. And so if we are resorting to the criminal enforcement mechanism, the law enforcement mechanism in that manner, we have to be careful sometimes about what the consequences will be in terms of whether it's interracial tensions or the like. I'm not here to say we could have a much deeper discussion about sort of the role of hate crimes or the role of criminal prosecution. All of you probably know that we have debates about this, but the main thing to understand is just to think about that and then to be careful in how we use the terminology that we're talking about. Sometimes we are talking about hate crimes, but oftentimes we're just talking about what I would generically call anti-Asian hate or hate incidents. That doesn't lessen the impact, the harm on our community. But by talking about it this way, it allows for a different discussion. All of us believe in public safety. All of us believe in the safety of our community. But then when we have these more nuanced discussions about sort of how we achieve that safety, I think we can have a more robust discussion. So next slide, please. We've already talked about this, so I'm going to go through this relatively quickly. Is obviously this is something that is very prevalent in our community. Well, we could go to the next slide. One of the things that again, Manju, I'm sure we'll touch upon as well, is what the statistics look like. The reporting that is being done is clearly underreported. The general surveys that have been done on this suggest that upwards of about 30% of the Asian American population has felt this in some way. Up to 60% of our population has seen this in some way. Let's put this in context. The Asian American community is about 22 million people. So if you're talking about 30% of our population, that's 6.6 million people, right? That is affecting our community, not to mention the relatives and the friends that have to experience that trauma with them. Next slide, please. The other thing to remember, I think that we've sometimes forgotten in this last year in particular, is that we've been enduring this for over 2 years now. Yes, COVID-19 started in January of 2020 in some ways, but the first acts of violence was starting in January, February of 2020, as in 2 years ago. There was a very well-publicized case down at a Sam's Club in Texas that involved, tragically, a father and his two young kids, 6-year-old and 2-year-old. Then, of course, in this past year, we have seen even more dramatic escalation of these types of physical assaults that we've seen. Next slide. And these are a couple of other examples. Obviously, Atlanta was sort of, I don't even know how to describe it, whether you call it the high water mark, the low water mark, whatever, right? But the other thing to remember is, at the same time, the Sikh community also suffered a very tragic loss in Indianapolis. Because sometimes I worry that in talking about anti-Asian violence, it does have a little bit of an East Asian tilt. I'm Chinese American. I will admit that I hold privilege in that way as a Chinese American male. But we need to be inclusive. And when we're talking about hate, to make sure people understand that this hate has affected all of our different communities. It hasn't quite affected the Native Hawaiian Pacific Islander community in the same way when you're talking about quote unquote anti-Asian hate. But when you're talking about the effects of COVID-19, it certainly, as one of the questioners, I forgot his name, mentioned, has had a very disparate impact. And so again, we need to put that all in context. Next slide, please. Thank you. So what do we at AAJC do? And I always think about this in terms of 3 buckets. One is education awareness. Second is response. And third is prevention. The first in terms of education and awareness. As Erica said, we do try to do quite a bit with the media. And part of this is making sure that we have our narrative right. And this is where all of you have a role to play. I know Daniel is on this commission, and he's done a wonderful job, not to single out any one commissioner, but it requires all of us, whether it's in so-called national press, local press, within our local communities, to make sure people don't forget that this is an issue. Make sure we explain to them why China virus, why Wuhan flu are dangerous terms. And it's not just about quote unquote semantics or words, that they have real effects. Next slide. The other thing to make sure we understand is that this is not new, right? That we have seen this over and over. Anytime we have this external threat, whether it is COVID-19 or frankly, whether it is tensions that we have with the Chinese government, we in the Asian American community suffered the effects, literally, with respect to physical violence, incarceration in the case of World War II and Japanese Americans, Vincent Chin in the early 1980s and the like. The other thing I would point out about this, and I want to be very direct about this, is if you look at all of these examples, let's think about who was it that actually was the attacker in all of these. Whether it's 9/11, against Balbir Singh Sodhi, whether it's Oak Creek, whether it's Vincent Chin, they were white males, and I am going to name that because one of the things that I see sometimes goes viral are these videos of again, I'll be very direct, African American males attacking Asian Americans. Yes, those videos are real. I'm not going to deny that those are that they're not real, but the statistics are also clear. 3/4 of the attacks against Asian Americans, as demonstrated by an NIH study and a University of Michigan study, 3/4 of the attackers are Caucasian. It is the small minority that are African American or other races. And we need to be clear about this because sometimes you probably have seen this in your own social media feeds, is that there's this talk about how African Americans are attacking our community. And that is just a dangerous narrative that we have to disabuse people of because it produces that specific type of divisiveness that benefits the white supremacists, benefits the white nationalists in what they are trying to do to our country. So that's one thing I want to be very specific in pointing out. Next slide, please. In terms of response, the things that we do have a reporting mechanism called standagainsthatred.org. Stop AAPI Hate obviously has one as well. The two of us work well together, so there's no competition, so to speak. And the main thing we want people to do is report their stories, right, to make sure that happens. Next slide, please. Other thing that we do is what's called bystander intervention training. And that is really an effort to help people sort of have some tools to respond to what is happening, right? And make sure that they know, what they can do in the moment. If they see an act of hate, how they can respond. And there's very simple tips that people can sort of simple acts that people can do to make sure that they are in a safe place and can help. Let's go to next slide, and then I think we could go even to the next slide after that. Sure. And then in terms of policy changes, this is where I look for help from all of you as well. Is you've heard a lot from DPC, a lot from DOJ, Erica, about things that the administration is thinking about doing. I'm looking at all of you to help implement that work, help make that real and make that actionable for our community. I think I will end there in terms of where sort of what we can do together. Obviously, I look forward to the partnership with all of you to think about what we do together, how we work with the government, how we work with our communities, because you guys are the trusted messengers. You guys are the ambassadors for all of our communities, and to find ways to be that bridge between what's happening in DC and the government and what's happening down on the ground is just such vital work. So thank you very much for that.
John, thank you. Thank you for all that you're doing and for your presentation here today. And for emphasizing what any individual can do as an individual or collectively to help address anti-Asian and NHPI hate and violence. I'm going to turn now to an important final panelist in this session, Manjusha Kulkarni, who's the co-founder of Stop AAPI Hate. Manju is the executive director of AAPI Equity Alliance and a member of the Los Angeles City Ethics Commission. She's going to share a compelling presentation on the staggering data provided through Stop AAPI Hate and what can be done to address this issue. Please welcome Ms. Kulkarni.
Thank you so much, Erica. Good afternoon, good evening to you all. Happy Lunar New Year to those of you who celebrate. It's an honor to be with you and to follow John, Shilpa, Chirag, and Rachel. And just want to express my special appreciation to Crystal and Erica. I was so delighted when they joined the administration in these key leadership roles. And also to thank Sonal. I know as she is chair, it has been great working with her in her capacity at TAF, and good to see so many other friends here in the audience, including I just want to do a shout out to Carrie Doy, who was part of our past leadership of AAPI Equity Alliance. Next slide. And so what I wanted to share with you quickly is just, what we've seen over the 18 months. Here are just a few examples of incident reports that have been reported to Stop AAPI Hate. You can read them yourselves. Really what we're seeing is across the board physical assault, discrimination in the workplace, and sadly even incidents that take place within schools. And the last example there is of a middle school child who was physically attacked and verbally assaulted. And that was sadly one that happened here in Los Angeles, even before there was a single confirmed case of COVID-19 in the United States. And so this is how we began our work. Next slide. And Chinese for Affirmative Action, San Francisco State University with AAPI Equity Alliance established Stop AAPI Hate in March of 2020. We immediately began to get several hundred incident reports from all over the country. And we made sure to have our reporting forms available in multiple Asian languages. And I think that helped to contribute to the strong reporting that we've gotten from across the country. Next slide, please. And this is just a little bit of our approach, which is one, to serve as the nation's leading aggregator of the data, to offer multilingual resources on our website, as well as technical assistance for community members and community groups, to offer and support in safety measures for communities and restorative justice efforts, and finally, to advocate for local, state, and national policies alongside wonderful organizations like John's, Asian Americans Advancing Justice, not only in DC, but also in Los Angeles, the Bay Area, Chicago, and Atlanta. Next slide. And so I want to delve deeply into our data very quickly, which is that since we began receiving these reports, since our establishment, we've received over 10,000 from all 50 states and the District of Columbia. As Shilpa mentioned, really women are bearing the brunt of this discrimination, making up 62% of those who reported to us. Other vulnerable populations include youth and seniors. Next slide. Oops, I think it skipped. And so when we think about what type of incidents have been reported, as John noted, really the vast majority are not crimes, but they're hate incidents. And you see that verbal harassment tops the list at 63%, followed by shunning or avoidance. Then we have physical assaults, and then civil rights violations, which include that workplace discrimination, refusal of service, being barred or prevented from public transit and transportation, and then also online harassment. Next slide. And most of these incidents do occur in places that are open to the public. So that is public streets and sidewalks, businesses. Often these are retail establishments, as well as then we look at public transit, parks, and sadly, even schools and universities have pretty significant numbers. And remember that even these numbers are relatively low, and we think that for schools and universities, that's because until this academic year, many of those were largely virtual or remote. Next slide. And we know that sadly, all of our communities are experiencing hate. While numbers are highest for Chinese Americans at 43% and other East Asian groups, Korean, Japanese American, we know that also Southeast Asians, Filipinx, and Vietnamese are experiencing them in high percentages. Also those individuals who identify as biracial and white and Asian. And that you see there at the bottom on the right-hand corner, even South Asians are experiencing hate, and Pacific Islanders. And when we did a survey with the Edelman firm, we found that actually Pacific Islander numbers, despite the lower reporting to us, are experiencing hate actually at the same percentages, about 1 in 5 or so. This was also confirmed by AAPI data as well as the Pew Research Center. So we continue to advocate and work with PI organizations as well as South Asian organizations. Next slide. And I'm going to skip this slide. John mentioned some of the impacts of the rhetoric. Next slide, please. And just acknowledging that there's significant mental health challenges. I do want to point to one stat here, which is that 72% of our community members in a mental health report we did with the Asian American Psychologists Association said that they're more worried about discrimination than actually COVID-19 itself. Next slide. We know this is having impacts in terms of unemployment as well as small business closure, really debunking the model minority myth. Next slide. And so just as I want to sort of end, the key takeaways are that racial discrimination is affecting all of our communities. Intersectionality matters, as we know, in terms of the gender data. Most of these are not hate crimes. And in terms of that question in the chat, there are the studies that have been done by University of Michigan and University of Maryland, Professor Janelle Wong, in terms of the race of the perpetrators. And these are not just simply about interpersonal attacks, but also sometimes governmental policies that have impact on our communities. Next slide. And so as I close, I'm not going to go over this one or the next if we could go on, but I want to say there are a number of policies. We want to make sure that victims are getting, and we'll end with this slide, that victims do get the resources that they need, and we would appreciate your close monitoring of the implementation of the COVID-19 legislation, monitoring and hopefully ending of the China initiative. And I think, I want to end with the fact that we are in solidarity with other communities of color, African American, Latinx, and you see in our history together, we have been aligned, and I think we can continue to be aligned as we bring forth solutions. Thanks so much.
Manju, you rushed through a lot of this to accommodate, I think, the robust interest that our commissioners have in delving in a little deeper. I really appreciate you. I'm truncating your remarks, but it paints just such a vivid picture, and the work that you do and what brings you to this work as a member of the community also helps us be seen because you quantified it. And that's one of the things that has been absent, I think, from mainstream imaginations or even policymakers, this far away inside the Beltway. So thank you so much for that. So I have two questions that have been teed up. We'll start with those, but just want to remind everybody this is so critical, and I mean one of the reasons why it's the longest session that we're having, and yet we're gonna leave feeling not terribly satisfied that we were able to probe every aspect of it. But we will continue this work. If commissioners don't have an opportunity to ask a question now, we'll carry them back and feed them back to you with responses. But we're also going to be discussing, through a subcommittee mechanism, the establishment of a subcommittee focused on belonging, inclusion, and anti-racism, where we're going to be digging in on a lot of these work, not just on a quarterly basis on Zoom, but doing the real work and hopefully having the benefit of these experts here to help guidepost us through it. So I will turn to two of our commissioners for their questions. If you don't mind, commissioners, directing the question, or I can do the steer. We're running short on time, and I apologize for this, but the information here is just so rich and robust. It was hard to not pack it all in. So first, Commissioner Halsey, Dr. Colonel Commissioner.
Yes. Thank you, Erica. Now I'll have to write you a prescription. You call me doctor. So my question, and my apologies in advance. It's not meant to be disrespectful. So my question is, we know that the previous administration, the Trump administration's anti-immigrant policies and rhetoric, I personally feel fueled a lot of this hate. And DOJ, DHS, ICE, Border Patrol, other immigration officials sort of seized on that opportunity and targeted our communities collectively. It's one thing to talk about white nationalists doing something, but it is so much more hurtful when you are the victim of institutionalized racism. So how do we build trust again between our government and our communities when we've gone through this 4 years of hell?
May I start in answering it? Great. Well, thank you so much for that question. And I think it really gets to the heart of some of what we're seeing. And I'll focus first on reporting. A number of local, state, and federal law enforcement agencies have, expressed concern, and rightly so, that individuals in our communities are not reporting to them. And one of the reasons is, in fact, because of their own policies, right? So when you have immigration enforcement that leads to deportation of Southeast Asians en masse, when you have local police working closely with ICE, separating individuals from their families, when you have programs like the ones we saw after 9/11 that were targeting Muslim, South Asian, and Sikh communities, that's what's going to happen is people are not going to engage with their governments and they're not going to report. So I do think it's really important, one, that we have all of you in this position, not only to be representatives of the White House and the administration, but to push back and to encourage the administration to do the right thing, right? To ensure that we get rid of programs like the China Initiative, to make sure that our communities get the resources that they need, and that when there is legislation like the COVID-19 hate crimes bill, that it's implemented in a way that protects our communities. So I'll stop there, but you're absolutely right in connecting those dots. And that's where I also see all of you as being key to the solution.
Thank you, Andrew. Anybody else?
Yeah, I could add to that, Erica. I mean, I think it's a great question. It's actually a broad question or a broad point that applies to much of what we're doing across the administration, not just what in terms of addressing xenophobia and racism against AA and NHPI communities. The reality is there's a lot of rebuilding of government agencies, sort of restoring of non-discrimination practices, and also the rebuilding of trust that the commissioner talked about. So I think there are some immediate things that were done, ending the Muslim ban, taking certain other steps that we're very quickly saying we are not the prior administration. But there is much more that has to be done. And this is why I want to emphasize the presidential memorandum that the president signed very early on. The presidential memorandum directed all federal agencies to take steps to ensure that they're mitigating anti-Asian bias and xenophobia, that they're not extending it, that they are not operating in a way that is entrenching and making anti-Asian bias and xenophobia worse. And so there is a mandate out there to the agencies. And I think there's a role here for this commission in partnership with us to identify what are the practices that should change. The agencies themselves are doing that work, and we work very closely with them to identify, what are the barriers to programs, what are the sort of harmful programs and practices that need to be undone. And I know we have very limited time here, but this should be the beginning of a lot of conversations where, as you identify areas for attention for us, places where we can work closely with agencies to get them to change their practices, that we know about that and that we can be helpful in that regard.
Thank you so much, Chang. I've got Commissioners Qureshi, Wang, and Ajrubli teed up. Commissioner Qureshi, do you have a question?
Hi, thanks so much, Erica. And thanks so much to John and Manju for helping ground us in what is happening to the community in their everyday lives. I had a question for Rachel. Hi, Rachel. My name's Nahid Qureshi. It's nice to meet you. Thanks so much for being here. And of course, Vanita's been a longtime champion on these issues. And I just wanted to ask you a quick question about what we discussed around hate crimes. Like, it feels like advocates, including myself, have been talking about the issue of the challenge of getting law enforcement agencies to report hate crimes for probably 15 plus years at this point. And so I just was curious as to whether or not DOJ is considering proposals or supporting legislation that would find ways to make it mandatory, either by tying it to grants like the Burn Jag grant, or considering some form of an audit for police departments who repeatedly report zero hate crimes or fail to report, particularly if they have large populations. Thanks so much.
Thank you for that question. The Justice Department, I would say, is always looking at all the methods and ways to improve reporting, especially looking forward to the specific grant funding that will be going to that purpose from the Jabara Hire grant funding streams once it's appropriated. But I will say that one thing we're also recognizing is that, even when we have the fulsome reporting from law enforcement agencies, we have deeper issues that we're seeing, including the lack of the ability for victims to report to law enforcement, the larger issue that we've seen where the FBI NIBR's UCR program collects data on hate crimes, and the vast majority of what we're seeing includes acts of bias, hate, discrimination that may not rise to the level of a hate crime. So one of the things that we're thinking through and working toward is utilizing all of the tools of the department to work with community-based groups, to work with those on the front lines who have been exploring new methods and ways to collect this data to ensure visibility of these issues. And some of the specific grant funding streams in the Jabara Hire Act include things like hotlines that are state-run, not law enforcement-run, and reporting portals that are that track both hate crimes and incidents. And so these are very sort of new, not new, but concepts that are new for some of us. And so it is the department's responsibility to be pushing this conversation and figuring out where do we land and how do we promote alternatives and community-based response and ways that we can ensure visibility even when acts may not rise to the level of a crime. So we have to utilize all the tools at our disposal. It's a great question.
Thank you, Rachel. Commissioner Wang and Commissioner Ajrubli, can we ask your questions in Syrian and then respond? Dr. Balbus has graciously delayed his start time so that we could wrap up here. So Commissioner Wang.
So my question was, I think, primarily for Shilpa, but perhaps others as well. I'm curious in terms of the administration's investment in prevention as it relates to culture change, as it relates to, my, personal perspective on a lot of this is that it's tied to toxic masculinity. But so I'm just curious in terms of addressing, some of this bias, what investments there might be there. So that's my question.
Thank you, Grace. Commissioner Ajrubli, would you like to ask your question?
Yeah, I'm just thinking in terms of some of the rhetoric that has been sort of bandied about not only on the Hill, but also amongst top leadership about things like around China, around North Korea, and thinking about the structural reasons on why we continuously, particularly during tense political times is that we continuously see rhetoric that often gets, unfortunately, so unreined that it affects people in the AAPI community and even in Muslim communities, and there's a lot of overlap in that regard as well, and as well as Sikh communities. So just wondering what steps are being taken to really think about the language that's being utilized by the administration, by all of the different factors that continue to instigate some of this.
No, thank you. Shilpa, I'm going to turn to you, and then it's going to be a free-for-all. I think we're all going to be competing to answer Mia's question because we all have lots and lots of thoughts on it. But Shilpa?
Yeah, no, it was a great question, Grace. And, there is a lot of efforts right now that are, I wouldn't say they're nascent because people have been talking about prevention for a long time. I think the challenge has been are we going to put our money where our mouth is and have the resources to back it up, right? So I think the American Rescue Plan, unprecedented investment there. There is funding and Build Back Better. The budget will have other pieces. So I think there's an increased focus, and happy to talk offline, but hopefully you'll see more. And I think, what's really great is that we're really working together across agencies, across teams in what feels, I wouldn't say new, but better. I think we're more closely coordinated. And so I think, want to create an open line of communication. So happy to talk more, but I think you'll be seeing more, and I think it's going in the right direction.
Thank you. Panelists, who wants to close us out with a response?
I'll start on Mia's question because that's something that I've given a lot of thought to, especially both in my work with commerce as well as having lived overseas in China. A couple of thoughts. First is, you are absolutely right. This is an example of, frankly, of white nationalism, white supremacists. In the sense, right, when we had the so-called Red Scare, early 1970s, early 1980s, the rhetoric around Russia, you never saw the same sort of backlash against the Russian community. Not to say that didn't happen. I mean, there were a little pockets of it, but let's be real. It's not the same as what we've experienced now, what was experienced after 9/11, what was experienced in World War II, yada, 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 right? So we should be clear in saying that. The other thing I would offer, though, as just and this will be maybe a little bit controversial for all of us here, is that we do also need to be nuanced in how we talk about it. Because I think we do need to be very clear in saying, we agree that what the Chinese government is doing in Xinjiang and the Muslim minority is wrong. We agree that what is being done to democracy in Hong Kong is wrong. That government is bad for many reasons. And we cannot penalize the people and foster our disagreements, political disagreements, on the entire culture of a nation or of a region. Right. So when we talk about it, we should be smart about that. And that's so we emphasize to our nominal allies that, look, we agree with you on this stuff. It's a matter of being nuanced in how we talk about it. Right. Because sometimes, at least initially in some of these conversations, when people would always tell us, oh, you guys are being naive. You guys are just a bunch of sort of, whether it's liberals or whatever, that are being too human rights or human rights towards our own country oriented. And this is our response is, no, we get it. Certainly for me, we get it, but we need to do this smarter.
John, thank you so much. Dr. Balbus and Chief Commissioner Shaw, thank you for your indulgence here. I knew this was just going to whet the appetite. I knew we weren't going to solve for it today, but I think that we'll have a lot of opportunity to follow up and to continue these discussions, including tomorrow when we have our discussion about how to move forward in this work, and then also again in the work in the subcommittee. Panelists, thank you. You're amazing. You're strong and courageous for us. We appreciate you very much. Chief Commissioner Shaw, I relinquish the Zoom screen to you.
Thanks, Erica, and thank you all for thank you for everybody that presented. It was such an incredible presentation, and I was so taken in and writing down so many notes. But we have a lot of work to do, so I want to really move on to our next session. And this is one of the key priority areas that we talk about: climate change. We talk about extreme weather. We talk about equity in the process of it, and it's important that we are able to talk about an issue that is happening in our communities, that is really affecting our communities, and making sure that we can have time for it. The administration has prioritized this issue across all populations as included in the scope of the work of the Commission and the initiative. Understanding extreme weather, climate change, and environmental risks that affect and impact AA and NHPI communities is critically important to the survival and long-term health of our communities. So today we have Dr. John Balbus, who is HHS's Director of the Office of Climate Change and Health Equity, and he's going to share a bit more about the risks and the impact on our communities. And he's also a physician and has served as HHS principal to the global U.S. Global Change Research Program and co-chair of the Working Group on Climate Change and Human Health for the U.S. Global Change Research Program. So with that, Dr. Balbus, thank you for your patience and thank you for joining us today. We're really looking forward to your presentation.
Well, thank you so much, Commissioner Shaw. And let me just start off by saying what a privilege it was to be part of that or be able to listen into that conversation in the last 20 minutes. It's a sensitive conversation. It is really uplifting to see the Commission taking on the healing process that we really need to be showing from years, from decades, really from centuries of this kind of traumatic activity. And it's in that context that I come to you today, a context of humility and wanting to be part of that solution, with the lens of addressing the layering on of stress, the layering on of risk that's coming with climate change. So with that, could I have the next slide? And what I'm going to try to do in hopefully around 20 minutes is to give you a quick overview of how climate change impacts health, why it needs to be viewed through a health equity lens, and some of the unique impacts that we've seen on the Asian American and Native Hawaiian and Pacific Islander communities. And then I'll close by talking about the office that I've been asked to come over and help start up, and the solution space that we have. And I just wanted to share this quote from your co-chair of the Commission, Secretary Becerra, who is a very strong supporter of this issue, that the time is now, right? That this is the issue of climate change is punctuating the issues we have of racism in this country, blending and combining to really affect people's lives in a very profound way. And the time is now to take those actions to protect our world and to address the twin threats that we're talking about today. So next slide, please. I'm going to start by talking about just what happened this last summer as an example of how these factors come together. And Hurricane Ida, slammed into the Louisiana coast in late August of this year as a Category 4 hurricane. And I'm showing its path because wherever that path was, there are communities at risk. There are communities at risk for reasons that people just live in different places, but there's also communities at risk because of forces of racism that have created neighborhoods or created the conditions that people live in, communities of color, communities of Asian Americans, Native Hawaiians, Pacific Islanders, that are related to the topic that we just had. So in striking the coastal Louisiana, that's an area where there are many people of Vietnamese origin who are commercial fishermen, and there was devastating impacts there on a community located there, in fact, for economic opportunity, but nonetheless in harm's way in that way. The storm, of course, crossed the United States and in a very unusual and fueled by the amount of water that the atmosphere holds now because associated with climate change, caused unprecedented flooding in the metropolitan New York area, northern New Jersey, New York City, and as the headline shows here, devastated communities and lives with a disproportionate impact on Asian Americans who, for reasons related to structural racism and the way we've segregated communities within the cities in the United States, were put in harm's way when the floodwaters came because they were living in basement apartments and buildings that were more vulnerable. Next slide, please. This is just one example of disasters that are exacerbated by climate change. Of course, 2021 was a bad year for the country. And this is just a map that came out recently from NOAA showing the distribution of climate, of weather-related disasters. And many of these, such as the droughts, the heat dome, which actually wasn't a disaster, but was a devastating impact in the West. The multiple hurricanes striking nearly the same place on the coast in the Gulf. And the extremes of weather, hurricanes, tornadoes in very unusual times, sometimes striking in December, sometimes striking out of the usual period. Wherever these disasters are occurring, there are people who are more at risk again because of structural forces that expose them to the hazards and deprive them of the same kind of infrastructure investments, the same kind of housing protections, et cetera, to be able to protect them. And a lot of this, of course, is tied with poverty, but there are other factors as well. Next slide, please. And 2021 was a bad year, but as you can see, the years have been getting bad. Over the last 5 years have been some of the most severe years for this country in terms of the number of devastating billion-dollar events. And just to the next slide, back to where this occurs, just so that we can see that these events are occurring. Not every event can occur everywhere, but certainly, we have the Gulf being hit by the hurricanes, the West by the wildfires, droughts, and severe floods and mudslides. Center of the country is at greatest risk for the extreme thunderstorms and tornado events. And then we had the flooding event that didn't quite make it on the map, but it's down there as Hurricane Ida below. And the next slide, please, just to reinforce the fact that that people of Asian descent are in harm's way almost no matter where these events are occurring. So there are communities in the upper central states and right into Tornado Alley, and of course the communities. There are many communities that are concentrated in the urban areas of our cities, which puts people in a special category of vulnerability to specific kinds of risks. So the next slide, please. Of course, disasters are one way to be thinking about climate change, and it's what gets in the news. It's what we hear about the most. But this is a slide that comes from my colleague, George Luber at the CDC, that is a way of thinking about the public health impacts of climate change in a more holistic way and reinforces the point that there are many different ways that climate change is impacting our health. The center ring there is showing the primary manifestations of climate change, either more extreme weather, heavier precipitation events, rising sea levels, rising temperatures globally, and increasing carbon dioxide levels themselves which have their own impacts on our ecosystems and our health. And then the next ring out are back to the slide before. The next ring out are what we think of as the pathways. So some of the pathways are pretty clear, the heat waves, the severe weather. Some of them relate to changes in our ecosystems, which lead to changes in where we see ticks or the kinds of mosquitoes that carry diseases like dengue or malaria. Or we're also seeing changes in the pollen seasons, more intense peaks in the pollen, and carbon dioxide may actually change the allergenic nature of some pollens. And then in the bottom left there, quadrants are things that are more about the displacement of people, more about profound, almost existential threats to water and food supplies, sea level rise, making land unable to be cultivated because of salination or salinating the water supplies. And of course, these are impacts that are most devastating in low-lying island states, which is where a lot of the populations we're talking about now either are living now in the U.S. territories or have had to migrate from and maybe have family back in those locations. So it's, again, a wide range of impacts that affect different populations in different places, depending on what are some of the more prevalent health disparities affecting those populations, or just where people are located, where they might be in harm's way. Next slide, please. And the next slide gets at this intersection of the social determinants and how people end up having worse impacts from climate change related threats. I won't go through this in detail because of time, but on the left side there, you see the way we think about the factors that make people more vulnerable. It could be because they are in a place where they're more exposed, or their job makes them more exposed because they're outdoor workers, for example. And that leads to people being more exposed. But there's also the interaction between underlying health disparities. So populations that are experiencing higher rates of asthma, obesity, diabetes, heart disease, depression, anxiety, all of the health disparities that we see that were so devastating to people when faced with the COVID pandemic are exactly the same kinds of health conditions that make people more vulnerable to heat waves, to being in an extreme event, to being exposed to wildfire smoke, et cetera. And so one of the key things that we talk about in our office to address the vulnerabilities of specific populations to climate impacts, or on the flip side, to making people more resilient, is doing everything we can to chip away at the health disparities, to work at those fundamental social determinants of health, to reduce the rates of those chronic conditions so that people's health is not quite as impacted when faced with a heat wave or an extreme event. And then lastly, the space between people being impacted and exposed and actually having bad outcomes has to do with many of the social determinants related to class, to poverty, to language proficiency, to education, et cetera, which, as we know, are very closely tied to structural racism. Next slide, please. So in terms of the specific impacts on Asian American and Native Hawaiian Pacific Island populations, the literature on this, for reasons we'll talk about in a second, is relatively thin. A lot of that has to do with the fact that the way we collect health data, the way we collect demographic data in this country often doesn't disaggregate by specific subpopulations. And so it can be very hard to understand the impacts. But these are data primarily taken from a wonderful resource published by the American Public Health Association and the Public Health Institute that just points to some of the ways that some of the concerns that would be greatest in these populations. In terms of heat, again, Asian Americans, in part because of concentration of Asian American populations within cities, are more likely to be exposed and to live in urban heat islands. And those urban heat islands, of course, are not just because somebody's in a city, but because somebody's in the part of the city that has not got the tree cover, that has more pavement, more, less parks, et cetera. And that's what creates the urban heat island. Native Hawaiian and Pacific Islander populations, some of them have higher rates of respiratory and cardiovascular diseases. And as I mentioned, that makes people more at risk when exposed to extreme heat, or of course, to air pollution in the slide below. And then those other factors, the sea level rise, the flooding, repeated flooding and challenges to food and water security. Some of these exposures are related to the coastal urban areas, as we saw when the hurricanes are hitting the bayous of Louisiana, or the low-lying areas in a metropolitan area like New York. But some of this is occurring, and of course we'll talk about the Pacific Islands in a second, but some of this is occurring in Native Hawaiian and Pacific islander neighborhoods within Los Angeles, where when you start thinking about environmental justice and this intersection, the cumulative stressors of not only living in an area that may experience flooding, that may have a lot of impervious surface, that may have a lot of challenges with heat, but it's also located next to a Superfund site, so that when the floods come, the waters are contaminated with toxic chemicals, and there's the threat of health effects from that as well. Next slide, please. And of course, many of these risks happen in urban areas like Los Angeles, but there are special and unique risks associated with the low-lying island states in the Pacific, whether that is, they're lying in the path of super typhoons and experiencing devastating flooding from supercharged storms in that way. And the slide on the right, shows the devastation in Palau from super typhoon Haiyan. But these lands are vulnerable for many, many reasons. The sea level rise is leading to repeated tidal flooding in a lot of communities. It's also leading to the salination of land and the loss of land for growing crops and the contamination of water supply, so that many people are having to rely on shipped-in water. And this is, of course, an international issue. The small island states have heroically stepped up to lead the United Nations in calling for more and more aggressive action on climate change to keep the global temperature from rising above 1.5 degrees. And it's a situation of just extreme concern. Next slide, please. And as we've been talking, the Pacific Islands, when we think about Superfund sites and environmental justice and people being put in harm's way from toxic chemicals, we tend to think about the domestic United States, we think about urban areas. But in the United States and, of course, in the Pacific Islands, there's a toxic legacy of U.S. military installations. We see this, of course, in the United States, but these are just images where we have this combination of nuclear wastes from the use of these islands as testing grounds for nuclear weapons, but along with the actual nuclear wastes, which can be detected by radiation counters, go many other hazardous chemicals that are in place and that are often in places that can be liberated when there are floods or changes to the ecosystems. Next slide, please. And again, this is a pair of maps that if I had an hour, I could have an hour of these maps, but this is just making the case that being in harm's way is not an accident. It's not random. It's very closely tied to historic and systemic racism. This is a pair of maps on the left showing the redlining or the zones that had been assigned to neighborhoods from the Homeowners Loan Corporation in the 1930s. So 80 years ago, the federal government teamed with the Homeowners Loan Corporation to create maps that would assess, according to that organization, what were the financial risks for investment in mortgages or other kinds of investments in the area. And of course, the areas that were green were the lowest risk. The areas that were red were considered at the highest risk. And disproportionately in the 1930s, the areas that were red were areas of communities of color, recent immigrants. In the East Coast, they were primarily African-American communities. In the West Coast, many of them in the 1930s were predominantly Asian-American communities. The graph, the maps on the right are from a study showing the asthma rates, and this is just one of many, many studies that show that the patterns of segregation exemplified by these maps created in the 1930s, that 80 years later, they can still be tied to higher rates of asthma, to preterm births, to greater exposure to heat islands, and so on. And so, again, just to note this relationship between the systematic racism of the 1930s, which of course was built upon segregation and racial practices that date back decades and centuries in this country, and that where people are with respect to industrial sites, with respect to roadways, with respect to poor wastewater drainage, is closely tied to these patterns. Next slide, please. And this is just a map of the original map from the Homeowners Loan Corporation of Brooklyn, where we started. I just wanted to make the full circle back to Hurricane Ida. In 80 years, and especially in the last 15 years, the mapping of redlining to communities of color and low-income communities doesn't always hold up, because cities like Brooklyn and other cities in the country have, in the last 2 decades, displaced the original inhabitants of those communities through gentrification, through investing and taking land that's of good value in urban areas, and often changing the demographics. Next slide, please. So with that, let me just pivot and tell you a little bit about our office. Again, the Office of Climate Change and Health Equity was one of the 3 mandates given to the Department of Health and Human Services by President Biden. The other 2 being to stand up a new working group to decrease the risk of climate change to vulnerable groups, and also to create a biennial healthcare system readiness advisory council to work with the health sector in terms of readiness and decarbonization. Next slide, please. This is a real busy slide, but when I have time, I would go through this in detail. As somebody who has worked on climate change and health for a dozen years within the federal government, it's really a new day. And the point of this slide is just that there is activity going on related to the executive orders, related to the fourfold priorities of this administration, which intersect in climate change and health equity, the emphasis on recovery from COVID, on systemic racism, on economic opportunity, and climate change, as I hope you see, all converge in health and climate change. And we have new opportunities and not a lot of time to be working on them. Next slide. For our office, we divide our work into 3 broad priorities, the first being that central mandate to protect the health of the most vulnerable. The second being what I was alluding to, that by addressing the built environment and its relationship to social determinants of health, things like access to healthcare, access to green recreation spaces, access to clean air, that by harnessing the investments that are packaged in the infrastructure bills to address climate threats, there's a lot of opportunity there to improve the quality of life and to improve the social determinants of health, and in so doing, reduce those rates of obesity, reduce the rates of asthma. So we're working to try to optimize that. It's not straightforward. It's the authority of health in these investments is limited, but I think it's something very important. And then the third area is just working directly with the health sector to make both the sector itself more resilient in terms of the facilities, in terms of the workforce, in terms of the supply chains, and then also to make the health sector, which constitutes about 8.5% of the greenhouse gas footprint of the United States, more of a part of the solution by working on sustainability and decarbonization. Next slide, please. I think this is a slide that was inserted, and it's a reminder of those areas for the commission. Could I see the next slide? Okay. And again, I know I'm getting low on time, but I won't read through all these. We're working in a lot of different ways to create this change. Right now, we're small, and just establishing ourselves, the ability to actually engage directly with communities is limited, but we're working with our partners at CDC, our partners across the federal agencies to identify the communities that are most exposed, and then to start to connect the leaders of those communities, start to connect the people there with the resources that often already exist but aren't reaching the right people, and to try to understand the gaps and to start to close those gaps. If you advance, I think that'll hit another 4 ways that we're working just in terms of the things that our office is doing. So you can advance. We're as an office also providing opportunities for underrepresented minorities in the sciences that we deal with, public health, environmental health, to come and learn and be able to help us in our work. And you can advance again. And of course, we're coordinating with the White House and engaging in public-private partnerships as well. I won't go into that now, but happy to answer a question if that comes up. Next slide, please. So on the solution space, next slide. I think I want to just convey the commitment of our office and the recognition that the solution space is both very local, in some cases hyper-local, and has to be attuned to the needs, to the cultural practices, to the specific knowledge and the specific resources and resilience techniques of all the people, of the people who are at risk. There is no one size fits all, and it has to be a two-way process. Specifically for thinking about the issues that the Commission needs to address for Asian American, Native Hawaiian, Pacific Islander communities, because there is so much heterogeneity in the subgroups that get put together in this categorization. One of the key things is just making sure we're disaggregating the data as much as we can, protecting privacy to be able to understand the populations being placed at highest risk, and also to be ensuring that we're getting the right language materials in the right places. And then lastly, there is a tremendous need to be empowering the communities, not just trying to bring solutions to them, but elevating the solutions that are arising within them and finding ways to support. Part of that is just supporting the narratives. Part of that is engaging in two-way partnerships to identify where the gaps are and find ways to close them. Next slide, please. And these are just examples of why we need to disaggregate the data, just the disparities or the heterogeneity among people who would be considered within the Asian American and Native Hawaiian Pacific Islander groups. And you can read those yourselves, but just the difference between Filipino Americans and Hmong in terms of poverty, the Marshallese versus the Fijians in terms of poverty, and the disparities in wages, white compared to AA and NHPI compared to Burmese and Bhutanese women. Next slide, please. And these are just statistics that corroborate that point, that there's heterogeneity among the English proficiency in different groups. And this is a huge issue in terms of healthcare access and, of course, access to any government resources. Next slide, please. So let me close with some messages of hope, and this is just one wonderful example. The Jojikum group in the Marshall Islands, the kind of work that I hope our office, as it gets established and we're able to do things, this is the kind of thing I would love to be able to do, to blend arts, culture, and the lifting of voices to especially working with youth, to be able to identify the path towards greater resilience and sustainability in our communities. Next slide. So with that, I will close. I won't read my conclusions. Hopefully they have come through in my conversation. And, our office stands, very eager to work with the Commission, to answer questions, and to work together to find the solutions, to raise the voices, and to, address the legacy in this country of racism and social injustice, to protect the health of all. Next slide, please. So there is our office's email. That's a way to communicate with us if you have suggestions, ideas, recommendations, questions. And I would also urge everybody on the bottom right there, you can see our URL. Please visit our website. It is going to be evolving rapidly in coming months, and please sign up for our listserv so you can get our notices as they come out. And with that, I'll turn it back to you, Commissioner Shaw.
Dr. Balbus, thank you so much for this great presentation. There's so much information here. I feel like I just need to go through these slides one at a time because the way you've presented it historically to sort of where we are and what needs to be done is incredible. Unfortunately, we don't have time for questions right now, Carrie. I'm sorry, because we need to close out to the day. But what I would suggest, Dr. Balbus, if you don't mind, is that we bring you into one of our subcommittee meetings, because I think there's a lot to delve into in detail here, and really thinking about the link between climate, health, economic is going to be super important. And you so well laid it out, especially with that with the slide with all the three different circles, which was incredible how you sort of did that. So commissioners, I'm sorry, we're going to have to cut questions short on this one, just because I want to make sure we can leave by 7. We've been at this since 1 o'clock today, so 12:25. Yes. So I want to make sure you all get some rest, and Dr. Underwood's been up since 4 o'clock in the morning. So I want to make sure
your stamina,
we get him some rest.
Would be delighted to come back and answer questions at another time, and to hear your ideas and to work together on solutions. That would be an honor.
And your closing, by the way, on how to bring arts and community together was incredible. So we really appreciate you joining us, and hope you'll stay engaged with us. We'd love to do that. Commissioners, we're going to rush through this next part, which is an active portion for all of us. So while we didn't get to ask questions, we do need your input. We have a Miro board here. We will not be able to write into this, but the team, who is incredible, has been taking notes all day and has been putting ideas on the Miro board. As we move forward here, we need to make some decisions too, and we need to think through what it is that the commission. What other information would you like to get? You've now heard a lot of presentations today. What I'd like to go through is question by question. So we're going to start with, what other information would you all like to have? And just blurt it out. Raise your hand. Let us know, and we're going to keep cycling through your ideas, and we'll capture your notes and your information. If you also want to put it in chat, we'll capture it there too. But if you could raise your hand, that would be great, and we'll make sure that we get your ideas in. So based on today, what's additional information you would like to have as you think through what types of recommendations we might think about? Carrie, you're on mute. You're back on mute.
Okay, hopefully you're
good.
I really appreciate all of the information that's been provided today. So much of it is so important and so compelling, and really does demand action. What is so important that is so urgent as we close out the day, because lives are in jeopardy, is that the AA and NHPI community is facing its own Flint, Michigan disaster with the contamination of the groundwater in Hawaii, where hundreds of thousands of people are being affected, and so the questions that I would have to ask is something being done about it now? Is it a multi-agency, multi-pronged approach? Are we having, can we get somebody from EPA to tell us about what's going on? Can we get somebody from HHS to tell us about the public health impacts? Is it multi-agency? Do we have the Department of Defense that's responsible, because of the Navy is responsible for causing this catastrophe? And is the Department of Justice taking a look at it to see if any laws were broken? Is it a multi-agency approach? Can we get reports from any of the agencies?
So team, I think we've caught Carrie's great question, which is how do we bring an interagency group together to get a better understanding and more information on what is happening with water. So let's see, Victoria.
There were a lot of mentions about like these community outreach dollars and navigating funds and things like that. I just wanted kind of like if there was like not a director, but lists, right? Because then a lot of local groups are having a lot of disconnects or gaps with, reaching out to those funds or resources. So I don't know if it's a directory of some sort, but it would be great to have some type of list, right, of these community funds or resources. And I feel like that's something that can be easily done, and just, hoping to get that request in for that list.
Victoria, that's a great point. Kimberly.
Hi, thanks. So my comment/question kind of dovetails with Carrie's comments. These were all great presentations from federal agencies and representatives from offices. So I'm wondering, how do we get our local community groups to be able to give input into what they are doing as well? Because I know from trying to get onto this committee, I spoke with a lot of different community groups, and a lot of them are very, very interested in many of these different topics, and they want to be able to give input as well. So how do we connect the federal agencies with our community, our local community groups, and not just the community health centers, but many others?
Yeah, it's a great question. I think this is also a place, Kimberly, we may want to think about how the regional agency group, the regional network can help us too. But it's a great point. Teresita.
Thank you. Tons and tons of information today, but we didn't get anything on affirmative action. And I'm just wondering if we should do that, given there's a Supreme Court case that will have lots of impact on our communities.
Great point. Michelle.
Thank you. Again, agree. Lots of information here. It would be awesome to hear from the Department of Interior on how some of the initiative's work is being incorporated into their goals and objectives for Native Hawaiians and Pacific Islanders, both through the Office of Native Hawaiian Relations and Insular Affairs.
Great point. Great flag. Smita.
Thank you. I want to reiterate the affirmative action point. I think that, one of the great comments made earlier was we're often looking at, and I think highlighted by Dr. Webb, was, Asian Americans are so much more disproportionately affected by things than we even realize. So affirmative action data, I wanted to sort of emphasize, but also on the regional network piece, I think what was just mentioned, the local community aspects, but also understanding some of the different agencies and departments and how we can deploy our information into the government, sort of government-wide, so we can be more impactful.
Great. Ajay, I know you had your hand up. Did you put it down? Sarah, go ahead.
I think almost everybody.
I have a couple of.
I think almost everybody mentioned data disaggregation in their specific department. If there's a way to consolidate which departments and who the contacts are for each of those divisions, I think every presentation had one. So it sounds like just to flesh it all out for everyone who spoke today.
Great point. Ajay, go ahead.
Yeah, Sonal, I have a couple of things. Would like to meet or talk to the IT departments of several agencies to understand what have they done or they're doing to convert their websites into multiple languages, including some of the key Asian languages. Number two, across the different agencies, from justice to transportation to HHS, what have they done in terms of translating the key materials which is being disseminated to public in multiple languages? Do they have a language coordinator, or what kind of, and how they are using the dollar amounts in terms of dispersing to the media to include Asian media over there? Then I also want to talk to someone to find out how are they giving API youth internship opportunities across different federal agencies? I'm not sure who to talk to and understand that, but how are the API youth being given opportunities in federal agencies? And then also on the immigration side, citizenship test is for adults who are 70 years old, grandparents or parents who are 70 or 75 and elder, for them giving test in English and understanding those questions is very challenging. So on the immigration, I have a couple of questions around, have there any discussion on citizenship test in API languages? And
okay, Ajay, I'm gonna have to, you have any more because we have a lot of people waiting.
Sure.
Can I cut you off on this one?
Sure.
Okay, sorry, we got a lot from you, so let's just make sure we captured your 5 points, and then if you want, why don't you put it in chat? We can also add in the last piece. Nahid?
Thanks, I'll be brief. Just how immigration policy, and particularly in the enforcement sector, is used to target Asian communities.
Great point. Mia?
Yeah, I know that a lot of them talk about data disaggregation, but one of the problems with some of their data is that they don't have big enough sample sizes. So I think what we really need to know from particularly researchers within the different departments, how are they gaining some of the data to figure out and talk with other Asian American, NHI groups or NHPI groups that trying to find out, like, how are they getting the data? Because so often we get told when we're asking about disaggregated data is that they don't have a big enough sample size. And we obviously have enough people in the United States to have enough of a sample size. The problem is that they're not getting the right data points. And so I think it'd be really great to be able to figure out how they're trying to do outreach to our communities.
Mia, that's a great point. Thank you. I think there was one more. I just want to make sure I captured. Simon, you had something you wanted to say.
Yes, I have. Perhaps we should group together in a different region. As an example, I know that there are some of our commissioners are in California. We should work as a group to kind of by the region, so to address some of the concern, anything that we want to work on, then collectively, then we submit to the commission. I mean, this is my thought.
Yeah, Simon, that's a great point. You should do that anyway, but I also think that because we're in a public meeting, it's important that we also, at least put out there what we know right now, and then we'll certainly have other, and as we do sort of our subcommittee meetings, there will be an opportunity for us to also collect information too.
Very good.
So I think your point is very well taken, and I hear you on making sure we're listening to the communities too.
Thank you.
So quickly, I'm going to go to just one more question because we're running out of time, and I want to make sure we honor our time. We'll extend by about 5 minutes here. We need to think about the subcommittees we want to establish, and I would love to get your thoughts on these subcommittees. We'll do chair selection a little later, but right now we do need to decide on subcommittees. We've got some already, so COVID and health. We've got anti-hate, belonging. One of the ones that we did not have is economic, so we should think about having an economic subcommittee. We have data disaggregation. We have language access. But if there's other ideas based on everything you're hearing, let's put them here because we need to have this conversation. And I know I'm sorry I'm pushing us to do this fast, but I know y'all have been thinking about this all day, so I'm going to push you to help me and help us. Let's put some ideas together. So just raise your hand, please ask questions, and please recommend some, and we'll just put them all here, and then we'll come back at it. I can't see hands. Sorry. Let me hang on.
Sorry, so now I put it in the chat already, but I would like to propose an immigration subcommittee.
Okay, let's put it there. Others?
This is Kim. One of the things that I'm interested in is, specifically it's human trafficking, but more broadly, it's about exploitation, sexual and labor exploitation, and it intersects with a lot of different other subsets. So I don't know if it would be a subset or a separate. I would actually call it exploitation because that's broader than just the criminal legal definition. But that's something I would do.
Sarah has recommended disinformation, misinformation, environmental justice from Carrie. I think we've captured all the ones I've seen in the chat. If I've missed anything, can someone please speak up? I appreciate it. Oh, Smita. No. Okay. Renal?
I'm an endocrinologist, so healthcare access.
Great.
And health equity in regards to chronic diseases.
Great. So these are great. We will have another mirror board session tomorrow. I'm gonna push a lot of this tomorrow so we can make some decisions. Apologies that we've kept you here this late today. I know you're all tired. And Dr. Underwood, I just want to say thank you for getting up so early and still being up. So really appreciate it. I want to turn it over to Crystal because she's going to summarize today, and then I'm going to give us our charge for tomorrow.
Thank you so much, Sonal. And as we close out this historic inaugural meeting of the President's Advisory Commission on Asian Americans, Native Hawaiians, and Pacific Islanders, I want to once again congratulate and thank all of our commissioners here today. And I also want to express my sincere gratitude to our commission's co-chairs, Secretary Javier Becerra and Ambassador Catherine Tai, and of course, our Chief Commissioner, Sonal Shaw, for their leadership. But this work does not happen alone, and I want to also acknowledge and thank my amazing White House Initiative colleagues, including our designated federal officer, Emmeline Ochiai, as well as our Deputy Director, Rebecca Lee, and so many other members of our team who have been working tirelessly behind the scenes to make today's meeting possible. We had a jam-packed agenda today, from being greeted by leaders like Vice President Harris and Ambassador Susan Rice to hearing from all of our esteemed speakers. And we've covered so many important topics over the past 6+ hours, from discussing the work of the White House Initiative on Asian Americans, Native Hawaiians, and Pacific Islanders, including its federal interagency working group and regional network, to hearing from former commissioners who spanned 4 different presidential administrations dating back to the 1990s, who shared their insight and best practices on how to tackle the work ahead, to subject matter experts from the White House, federal agencies, and nonprofit organizations who discuss the work that is being done to address immediate challenges facing Asian American, Native Hawaiian, and Pacific Islander communities. We also learned more about what the administration is doing to address the disproportionate health and economic impacts of the COVID-19 pandemic, the rise in anti-Asian hate, and the need to address the impact of climate change on AA and NHPI communities. These are not issues that we are going to be able to tackle in the course of a few hours or even a few days, but I hope that the presentations shared today help to spark consideration for the work that you would like to tackle in the months and years to come. There was a lot of information shared today, but if there is one key takeaway I hope that all of you leave with, it is the understanding that what a unique and important platform you all have through this commission to build on the foundation laid by prior commissions, to develop recommendations to the president, and take bold and decisive action that can truly make a lasting difference for our communities for decades to come. So thank you again to our commissioners for your leadership and for agreeing to be a part of this process. We've had a very long day, and I know we span multiple time zones, so especially a big thank you to Dr. Underwood in Guam and our colleagues in Hawaii who had to wake up especially early this morning. I know we have another packed schedule tomorrow, but the president could not have appointed a better group of individuals to drive the work that lies ahead. So thank you again. With that, I will turn it back over to our Chief Commissioner, Sonal Shaw, to close this out.
Thanks, Crystal. And again, I want to just echo Crystal's remarks. I mean, thanks everyone for staying so engaged. I mean, the fact that we've had questions throughout the process really shows how much you've been paying attention to all of the details and really pushing us as a team to think broadly and also to think about all the issues that are affecting our community. So thank you for your engagement. Tomorrow, we're going to examine more of the systemic issues that are affecting our communities. A lot of what we heard today is the immediate issues. We'll also want to look at a lot more of the systemic issues affecting our communities. Dr. Balbus today sort of addressed some of that in the beginning of like what historically has been happening. So we'll carry more of that on tomorrow to have that conversation. We'll also talk a little bit more about data desegregation and more details around it, land access, especially, and then most importantly, but what we ended on today, we're going to establish our subcommittees. What I want us to remember on these subcommittees is we are staffing our subcommittees, so we're going to have to put in the work. So as we think about these subcommittees, we'll have the team working with us, but we also have to participate and be a part of this. So what I might think about and what I might suggest that we think about, given that we have time frame, is maybe we start with some subcommittees, provide recommendations, move on, and maybe we can establish portions of the committees that can take on other sub-issues within those communities as we think about the subcommittees moving forward, because we all also have limited time and we also have to make sure how we use our time effectively. So we want to definitely do that. So again, I look forward to seeing you all tomorrow. We've got another packed agenda where there's a lot of stuff that you're going to get again given to you. And I know there's going to be many more questions that come out of it. But more importantly, I really look forward to working with each of you as we move forward on the subcommittees, because from what you see today, there's a lot of work to do, and we can get a lot done, but we really we have to really get to it. So I really appreciate the time y'all are putting in, and I can't wait to work with all of you, and especially given all the questions you all have been asking. So with that, I want to say one more time a huge thank you to the team at the White House, HHS, the AA and NHPI Commission leads, Crystal. Really thank you everyone on the team for all the hard work and for everything that you've done to pull this together. So I look forward to seeing all of you tomorrow. We've got a lot of work ahead of us tomorrow, but thank you for staying with us, and thank you for allowing us to go a little bit longer today. Have a good night, everyone.
Thank you. Bye.
Thank you.